Welcome, everyone. Today, we're going to have a fun conversation with Dr. Daniel Winarick about a variety of different things. What I wanted to focus on mainly, but we can jump around all over the place regardless. And don't worry, to those that mention that I talk too damn much, we're going to go ahead and let Daniel speak a lot more than last time, because I think we understand where we're coming from, and a lot of the precursor conversation and stuff and red tape. Well, not red tape, but you know what I'm saying. All the beforehand, the primer stuff is out of the way now, so we kind of know a lot about where we're coming from. But the emphasis I want it to be is on practice, on not so much theory. Theory's good. We can mix theory in, but I want to know more about how do we deal with these issues? How do we deal with stuff that has to do with cloisterae, issues, pathology, and otherwise, and what approaches you take, and so on and so forth, and suggestions we can discuss pertaining to some of the stuff we brought up in discussion in previous times, and as we will now. But in any case, just in case, I guess it's the normal thing to do since somebody might stumble across this without knowing who you are. Go ahead, Winarick, give them just a quick rundown, so tell them who you are.
Sure. My name's Daniel Winarick. I have a PhD in clinical psychology, and for whatever reason, I became pretty interested in schizoid personality disorder and made that a rabbit hole for my graduate school life that I dove into and wrote a pretty good dissertation about it that people seem to like, that then turned into a journal article, and then actually a Psychology Today post that I put in a lot of work on before I realized how little work people put on Psychology Today posts. So it, reflects a different level of quality. But I think
throwing shade right off the bat.
I'm speaking the truth.
Love it.
But it's really a good. It's a good post. It's called The Disappearance of the Schizoid Personality. And it's the title I'm particularly proud of because, as we know, schizoids disappear and the diagnosis is actually at risk of disappearing from the psychiatric nomenclature. So
let's not let that happen, right? We don't want it to disappear.
That's my goal. That was the whole purpose of my dissertation. When I saw a paper published like schizoid PD lacks validity, remove it, I got upset. I have a good amount of research experience, and that gives you a certain type of knowledge about people with schizoid personalities, but more recently I've been in private practice, doing psychotherapy and testing since about 2017. Where people with schizoid personality disorder, people who think they have it, find me in various ways because there's just not many people, who specialize in this or know anything about it or take it seriously or even acknowledge that it exists for that matter. So I'm quite proud to be somebody who does, and it's challenging work. I'm happy to talk about, some of what it's like to work.
Yeah, I'd like to hear some of those challenges. Like as we talk, as it unfolds.
So what, I can give you a sort of, I can't say it's like the universal presentation, but what happens sometimes is, it could be a parent actually of a 20-something-year-old that calls me who says, I don't know what's wrong with my kid. They're like doing weird shit. They're staying in the room, like on the computer. They're not wanting to go out and meet people. And, this is coming from a place, I think, of anxiety on the parents' part, sort of a competition anxiety. Their friends' kids.
Well, if they're over 18, they probably want the kid out of the house.
It's more complicated.
No, I think he's right. It is usually competence anxiety. I think you're right about that.
Some regard
about whose competence anxiety,
the parent and for the child, because the child isn't doing what other kids are doing, not living up to the same expectations, not reaching the same milestones.
Absolutely.
Right?
But ironically, these kids have graduated from very competitive colleges, or they went, sometimes at least. So in this sort of patient, it's sort of quite a dichotomy between, what they're capable of objectively, academically, and sort of their parents viewing them as essentially, incapable of functioning in society.
Right.
So parents are usually kind of annoyed with the whole psychiatric medical system. They feel like nobody understands their kid, and they are skeptical that I'm going to be able to do anything that will help them. And it is hard. I mean, forget what I say to the parents, but in working with the people, the adults, I mean, men or women, there's sort of a similar prototype of, actually people are pretty good at coding. They don't like to talk to their family that much, and they feel different. They're not into socializing, everything that and all the overlap with the, some Asperger light, type traits.
Can we dive into that for a little bit? What do you mean by Asperger type traits? Yeah.
I actually would rather describe them as schizoid-like traits. It's just, I know that they can also be described that way, or they are described that way. And those traits just mean like a hyper focus, getting lost in a flow state, on something that other people are like, what the hell are you doing? But you're like, totally alive while you're doing it. And I think it's more, I think it's appropriate to call that, a schizoid state, actually.
Yeah, well, depending on what the thing they're lost in is, right? But it's obviously not normative. It's not a normative.
Right.
Kind of, yeah.
No, it's not normative, and unfortunately, it bothers a lot of normative people.
Why do you think it bothers them?
I think, I think parents, all parents are somewhat narcissistic. They feel like if they're judgmental, it may reflect badly on them. They may have genuine concern, what their values, what they think it means to live a good life is not what their child or, adult child thinks it means to live a good life.
Yeah, to have like a network of relationships and with varying competence and status values and going to events and celebrating holidays
and being able to just seamlessly go to a family dinner with a bunch of people and smile and participate or something.
Yeah, of course that would be
do so sincerely.
Yeah. Of course that would be intolerable for the people in question.
Yeah, and so a lot of times they manage to just stay in their room or stay, for a short amount of time. But the exacerbation I see on parents' part is, that's the challenge is working with parents of adults who view their children, like I said, as less competent as they are objectively, even on IQ test scores. So part of the challenge is explaining all of this to the parents.
Can imagine.
But some of the interesting stuff in working with people with schizoid PD is like, the therapy is not, it's not terribly earth-shatteringly exciting all of the time. And that's totally fine. And that,
what would you say is why would you define it as not earth-shattering all the time?
Because there's a lack of there's a hesitancy to open up, emotionally in a way that other people might about certain issues. So certainly a lack of affective expression, intensity, and there's a contentment in just sort of chilling. And just being okay, actually not saying that much. And that's the challenge for therapists. And I think they could do better by getting more comfortable with the fact that you can be feeling awkward with someone with schizoid personality. And that, that's part of the process, actually. Because even though it may feel awkward, you're actually connecting in a certain way and getting a better sense of, their internal world. And I think it actually builds a lot of trust.
So follow-up question to that. So there's the awkward phase where not much is being said and not much affect is being expressed. Is there then like a phase of where a pocket of like atypical affect is sort of discovered within a certain domain?
You know, I wouldn't describe it like that. To me, that sounds a little bit Hollywood-esque. I think that it becomes clear that people feel strongly about different things. They may not express it, you know, in some cathartic outbursts, but over time it becomes clear that people, you know, care about things.
I don't mean atypical in terms of the level of expression, like an emotional outburst like that you would see in a movie. I mean that the subject of the emotion is a little
No, there's a change in that. I mean, as you can build rapport, I think, you know, in therapy with anybody, a big part is rapport and relationship building, so that the person feels like, you know, you're competent and you like them and they like you, and, you know, you both kind of want to work together. I think people, you know, with schizoid personality are susceptible to, you know, the imposition of other people's worldviews sometimes, not always, not all of them, but passivity can be a feature. And, you know, they can be sort of rolled out, you know, people can sort of roll over them in certain ways with, you know, their values. And, you know, to really help someone see that they're, you know, they're fine or something is very powerful.
You know, what's interesting about that, the idea that some Zoids, because of the passivity, can get rolled over. Like, I often wonder how much of it is, say, a rolling over of a person and their values, and how much of it is they're willing to sacrifice certain types of or make concessions to certain types of things just to be left alone. And just to because those values that are being rolled over aren't actually the values that they hold near and dear to them.
Yeah,
like they might be on a, you know, I'm just a thought. No,
it's just thought. I you know, that resonates with me. You know, that the values that they're being rolled over on are not necessarily
something they care about. Yeah, or something they necessarily are preoccupied with.
I mean, I mean, there's things that we might say. I mean, this is the line, though. It's like it starts out as something that you say to get somebody off your back, but then you have to keep saying it to get them off your back, and then it becomes more and more ingrained in terms of this is what we say to avoid a negative outcome, and so
it starts being reflexive. Yeah, it becomes a reflexive strategy. Yeah,
and is it? You know, I think I find that a lot of people with schizoid personalities, you know, actually have, you know, pretty close connections with people, you know, whether it's online through gaming or whatever, it's one or two people. And those are often, I think, minimized by, you know, other people in their lives. And
that's a really good point. And that's actually something I wanted to talk about.
Oh yeah, me too. Some questions pop into my head too at the same time, but go for it.
Yeah, well, I think it's important to reinforce how those relationships are real, valid, and encourage more.
Yeah. So because that's the thing. Of course, not every schizoid person with a schizoid personality has a relationship like that. Right. And the ones who don't, a lot of them don't know that it's possible.
Yeah,
right?
I know.
Right. And so like whenever someone asks me the question of like, what is the goal? Like what can we actually do? Like what would progress look like? What would be a better life to live?
Well, you know, listen, I mean, intimacy is absolutely possible and it's obtainable. And I think It's important that it's with the right partner. And in a way, schizoid intimacy is arguably healthier than other types of intimacy.
Explain. You have to elaborate on that. You have to.
I will elaborate on that. Okay. So there's something called the capacity to be alone. All right. Mm-hmm. And that means that you're able to be alone. You can self-soothe. You're able to concentrate and get shit done while you're alone. you're able to find joy in different activities and, basically find life satisfaction being alone. And that's a really healthy thing to be able to do, because we all have to deal with being alone at different points in our life. Mm-hmm. And a lot of people struggle with that immensely. And when they're alone, they go to pieces and do desperate things to be with people. So in some way, a schizoid relationship where someone is able to be alone, that's a healthy trait. And that is something you potentially want in a partner. I mean, you don't want it to be too excessive, but, I think there are relationships with people with schizoid personality where they can find a partner who also has the capacity to be alone. I think that's the main thing, is to find someone with that capacity. And so theoretically, I mean, I don't know how much evidence there is, but there's this theorist, Winnicott, who you probably have heard of, or listeners have heard of, which I love. He's very, sort of kind and a good person. But he thought that the capacity to be alone started with being alone in the presence of your mother. But, in modern day, it would be like whoever your caretaker is, to be PCD or something.
Yeah.
But basically, to have the experience of being alone with another person who's not being intrusive, who's letting you do your own thing, but it's just there. Mm-hmm. And then having that experience lets you develop, a sense that you can be alone with other people. And
yes, alone with other people is very nice. I know exactly what you mean.
It's very nice, and it's healthy, and it's, in fact, I would argue, desirable. It is a desirable goal for anyone.
You heard it here. Winarick says more people should be schizoid.
So on the topic of schizoid intimacy, there was I don't remember what book it was, but there was an anecdote that I read where there was a girl, and so she was talking to her therapist about her relationship. And the way she would phrase it is she would say, I need to work on my relationship with men. And then, but what she would mean by that was her boyfriend that she had. But she talked about her boyfriend and managing that relationship as working on her relationship with men.
With the conceptual thing, that the concern being the
well, that's not. I guess I shouldn't be smiling or laughing. It's just obviously it's an unusual thing to describe.
Yeah, what's funny is that sounds totally not unusual or out of bounds in my brain. It's so funny. I hear it, and that's
it's like it's defensive. It's like I can't acknowledge that I have this fucked up relationship or unsatisfying relationship, so I'm just going to make it about my entire attitude towards men.
Well, I don't know that the relationship. I don't know that the relationship was necessarily bad. I think the relationship might have been okay. It's just that as she was saying it, the way she expressed it was her relationship with men, and that's something that actually sort of resonates in the way that I have experienced relationships or just interacting with people. Is that the way that I love people is mostly by staying within the category of people and then seeing individuals as instantiations of humans.
People, yeah.
And then I'm like, well, I care about humans, so I care about this person. And then I act, right? And so when she said, I'm working on my relationship with men, right? I do that, but instead of...
You were like, okay, I get it.
Yeah, I was like, yes.
Yeah. Her boyfriend is men.
Yeah.
Her boyfriend is men.
Yeah. Right.
He's the symbolic, the symbolic.
Well, and it's the instantiation of a category.
Of a category, yeah. And that's oftentimes what I hear.
With the apple in front of the face,
Yeah, and that's what's interesting. I think that's kind of what I was curious as to if you've ever come across anything like that, where you have patients that are more concerned with broader categories of things and not so much on the individuals in their lives, but they can sometimes connect to individuals via those broader categories.
That's a hard question. I have to think about that.
No, that's fine. We can push that one back. Birb, I know you had a few, so go for it.
A few questions?
Questions. I know you were. Well, that's all we were talking about before we got on.
Yeah, I mean, I can also talk about other strategies.
Yeah, I want to hear about that. That's what I want to hear about. I want to hear about your strategies.
My original default position was the best treatment would be, and I don't know how you guys feel about this, but to increase pleasure during solitary activities. If I were writing a treatment plan goal,
increase pleasure during solitude. How would one go about doing that? Like, are you talking about something to combat like the anhedonia?
I'm talking about like leaning into the fact that you enjoy doing stuff alone and trying to maximize that in a way that is helpful to your basic self-preservation and survival.
Yeah, so I think there's a lot for schizoids, there's often a lot of shame around the fact that they want to do everything alone.
Right.
And so that shame can actually be an obstacle to you using that resource, right? So it might be, well, in a perfect world, I would be learning a bunch of stuff that I'm interested in by myself. But I think that the only way I can successfully do that is by integrating into a normative societal plan. And that is so intolerable to me that I'm just not going to do it at all.
So right, it's important to normalize their desire to do that solitary activity, encourage it, and strategy. It's a problem-solving sort of technique of how can we make this more fun, or what is fun for you to do alone, and do it. It's fine to do.
One thing I want to bring up though is that I think it would be a very case by case, because there's oftentimes a lot of schizoids that are they're actually quite fine with announcing that they like being alone, and they have no problem making it a statement. But at the same time, they talk about often being alone and doing activities and losing interest in even activities that they do by themselves. Hence, what's often referred to as anhedonia. That's always prevalent in a lot of schizoids. So even activities that they do by themselves, like playing video games, doing puzzles, reading books, whatever, oftentimes they lose their luster fairly quickly for a lot of them. And I'm wondering your thoughts on some of that.
Yeah. Of course, I could see that happening. And I think there are some ways to maybe, buffer it or make it less likely, but the reality is it happens. And there are, other techniques should address the goal of helping people to, enjoy non-solitary activities as well.
I mean, because what's interesting is that I think maybe broadening the categories of what counts as a non-solitary activity. And I think what would be, for lack of a better term, and a more eccentric or idiosyncratic definition of what that could look like, or what that could be, or what that might look like to them. So it's important.
One person with high levels of schizoid traits, found bowling as a really fun hobby that sort of came and went. But it's just an example of an individual sport that you do sort of with other people, but you do alone. I'm not some advocate of sports, but it's just, an example of solitary semi-social activity. Unfortunately, he hasn't bowled in quite several years, so it's not huge.
But just taking it back to what you said earlier, and it's interesting. You had said that a lot of the solitary activities, or the community activities that sometimes you see schizoids take part in, are online, right? They're playing games together, they're watching videos together, they talk about movies together. They're on like Reddit and Discord, and they're joining things and discussing topical stuff, right? Or whatever philosophy, whatever it is they're interested in.
They're being uncharacteristically social in atypical ways.
Exactly.
And they do like to discuss philosophy. So the more that one could facilitate, some sort of group, I think this is a novel idea. It's not like so many people have researched how to help people with schizoid PD. But in my opinion, a process group would be quite interesting.
Describe it.
And worth trying. So group therapy is this category of psychotherapy where is what it sounds like. Okay, but most group therapy is very manualized and structured, and there's like goals, and you're supposed to like teach people different skills in the group. basically, in a didactic way. A process group is totally different. It's basically a group where, you know, there's no structure. People in it sort of say whatever's on their mind. You know, there's a facilitator who, you know, can say more or less, but basically is sort of just describing what's going on in the group. And it can be challenging and intense, but if you had a group with just people with a similar personality style like Schizoid, I think that people would actually find that sort of connection where it's unstructured. You're encouraged to sort of be incredibly blunt about what you feel about the other person and what you think about them. That's really the ultimate goal. And to, you know, be honest and totally fearless of any judgment. And, you know, part of how it works is just that experience of doing that. And, you know, sometimes, you know, even more types of learning can happen. Like in an unstructured group, relationships occur between the different members of the group, right? And different types of relationships occur that may reflect long-standing relationship patterns. Even schizoids may have different types of
absolutely
relational patterns. So, you know, in a good process group over time, that would be confronted and addressed. I mean, I'm not, you know, it's not so much fun all the time. These process groups get
sounds like
intense.
fun to me, but
I mean,
I define fun differently.
I was in one. You know,
well, what's funny is that, like, okay, this is what's funny. The server that I have, the Zoivoid, it's kind of a process group in the sense that a lot of the rules that are there are just structured for people to feel like they could be themselves, speak their mind, as long as they're not like harassing other members or breaking TOS, you know, Discord TOS or other things like that. Like certain types of bluntness is fine. Certain like types of just like people are going to disagree with each other without, you know, feeling scared about it.
Yeah, and people could really say something quite biting.
No, they but this is what's interesting.
And that's okay.
No, but this is what's interesting. Even with that stuff in place, one thing I've noticed about a lot of schizoids when there is a community of them is they tend to be very polite.
Mm-hmm.
They tend to be very polite,
lovely, caring of each other, protective, and
and what's funny is what's funny. I like that. What's funny is that a lot of the times, even when they have the option to be, say, not sugarcoat something, they won't. They'll start doing it in really atypical ways, like where it'll be like it's not so much sugarcoating. It's just, hey, I want to say something that might be difficult, or I want to like they'll kind of prep the person, or they'll you know, they'll do stuff like that, but they still take consideration for the person before they do the biting or difficult thing.
And look, there's a lot of people who'll struggle even doing that. And I think it's a mistake to overlook that as a schizoid dynamic, which historically has always been a key feature. And that's problems with aggression.
Really?
Can you go into more detail?
I need to hear about that. I don't hear that.
Oh, yeah, sure. This was,
I want to hear about, I mean, I want to hear problems with aggression.
Yeah, but it's not necessarily it's not anger management problems. It's sort of in the opposite direction. It's like problems being confrontational, problems being assertive.
Oh, okay. I see what you're saying.
And
absolutely.
You know, and that could be for different reasons.
What were we saying? What were you saying that it cut when it cut off? It was good. It was getting somewhere good. It was about aggression.
Aggression is underlying schizoid personality.
Inability to be aggressive or assertive.
The inability to express aggressive feelings. And the other thing that's common is an experience of intense ambivalence about everything.
I want to leapfrog off of the intense.
I know. I was about to
ambivalent.
jump into you do it, Burb. I know where you
Ambivalence.
This is important.
I
Yeah,
want
the
to jump off
intense
the
ambivalence, how it's defined and why it's there.
I want to get into the intense ambivalence and actually the relationship to schizoid intimacy and how you go from being a schizoid with no relationships to a schizoid with some relationships, you know, potentially very deep and meaningful relationships. So I think here I'll just talk about personal experience in terms of how I got from not having any relationships to having friends and having a partner. So I think it's actually fairly common for schizoids who are, you know, in their adolescent phase to think that they are psychopaths for a split second.
Yeah, I thought that. Me.
Yeah.
Well, some asshole named Ernst Kretschmer in the 1930s coined a category of the schizoid psychopath.
Right. So well, the reason that false conclusion comes up so often is because there's this feeling of a lack of interpersonal affect. Right.
Yeah. And not to mention that media portrays people with a lack of interpersonal affect as being psychopaths or something.
Right. So we'll have experiences like, you know, like will really relate to something like loving kindness meditation, where the goal is to ponder your compassion for the category of all beings, right? And we'll be able to do that and do it very well and really engage with the activity. But then transitioning from the category of all beings to a specific person is very, very, very difficult.
Sure. If there isn't a person who you feel you can be alone with.
Well, you know, even if there is a person that you feel you can be alone with, even if there's a person that you have a good rapport with, right, it can be difficult to make that transition. And so you might be sitting there in a room with your partner and you're in the mode of thinking about how you love all beings. And then you're like, well, how do I transition this into feeling this interpersonal specific love for my partner? Like, I love you, you are my person, and expressing it.
And that's the issue too, is that oftentimes I've heard a lot of schizoids tell me that the reason they might not express something, like something emotional.
Your audio, Angst. Your audio.
What's wrong with it? You can't hear me?
You're kind of
got a little soft.
Okay. Okay. Is it better? Is that
better?
better?
A little better. Yeah.
Are we good?
Yeah, we're good.
Okay. What I was gonna say was, I've heard schizoids tell me that one of the difficulties is not so much that they can't express an emotional thought or feeling about something, or it's just that it's when they're talking about people, they can't exactly express it in the way they're experiencing it because it has to be wrapped in this interpersonal context. Otherwise, it oftentimes either insults the person, makes them uncomfortable, something and so forth, right? Like, me and Burb always joke around with this, that like when we care about someone, at least in my case, I see somebody as a collection of traits, and like you said, Burb, an instantiation of a good person, a person that I think is good with traits, a collection of traits that I believe to be valuable and good.
Among countless others in the ether who are just like that, which you all love, all of which you love as well.
In some extended capacity, of course. I love that that type of person exists.
Right, but then it sounds like you're saying, but then the person you're sitting in the room with is not that.
No, but they are that. Otherwise, I wouldn't bother with them. Well, at least they should be. They should be an instantiation of that if you're going to be, having them as a partner.
Yes. So I think the challenge for schizoids with intimacy is that, believe it or not, you know, schizoids are actually quite desirable romantic partners. There's actually been literature
based
on.
Oh my god, that's funny. Why are we so hot?
What the fuck is based mean?
No, I mean, it's just people use it all the time when somebody says something. No, when somebody says something that's like speaking some like truth, and it's just like some big truth.
It's true. No, it's true in the face of wide institutional opposition.
It's usually what it's referred to when you say something that has institutional opposition, and you just say it like, and you don't give a fuck. It's usually when people say.
Look, I'm gonna, this. If any academic psychologists listening to this, they're gonna maybe be upset, but there's this woman who's a psychologist named Nancy McWilliams, so I'm sure you've heard of. Maybe not.
Yes,
She's at Rutgers, and people like worship her as her the expert on schizoid. My dissertation advisor is like, "Oh, you have to use Nancy McWilliams." I get the source. I'm like, "This what?"
Well, give us the critique. Give us the critique. You know what? So we stay on topic.
You
You know what? So we stay on topic.
I'm trying to stay on topic.
No. This is good. That's what I'm saying. So we stay on topic. Could you tell me what some of the critiques are of the methodology or the things they discuss, and why you think those critiques would be detrimental, say, practically in therapy and stuff? Like, what's the issue?
Well, they're detrimental for a lot of reasons. I mean, the biggest critique is just a lack of any conceptual clarity and attempt to define, what it is that they're talking about. It's almost like there's an implied meaning for what schizoid is, but in psychoanalytic circles, maybe there is some shared understanding, but it's a very complicated syndrome that, you have to take into account what the DSM says, you have to take into account what the clinical literature says, and she treats it sort of flippantly in a way as though it's just, quiet, creative people who don't like intimacy. I mean, there's some truth to it, and there's value in what she writes, but I find it lacking compelling and any empirical anything. It's superficial and it lacks any empirical evidence, any semblance of
all right, so you heard it on
but maybe don't
Nancy McWilliams.
Oh, Jesus
no I gotta say it. Nancy McWilliams,
she is so well loved.
No, I'm sure she's well loved. All I have to say is if you ever see this Nancy McWilliams,
God,
you should come on my channel. No, you should come on my channel and debate Dr. Daniel Winarick.
Yeah, come debate Dr.
A kind, civil debate.
Full disclosure, this is going to make me look bad or make her look bad.
Okay.
So her famous article, Notes on Schizoid Mechanisms or whatever, where evidently she describes the typical schizoid histrionic romance. So in her mind, histrionic women are attracted to schizoid men and vice versa. First, because of their personality dynamics.
I don't agree, but all right.
I mean, I just thought it sounded like an interesting idea, but I couldn't get through the article, so I didn't even read the whole thing.
Okay,
so
well, you're gonna have to read the whole article if
I will
set up a debate with it. Okay, yeah. I'm gonna get. Right. I mean, she's supposed to be a schizoid person, so we got to get Williams on here too, right?
I'm gonna pull us back on topic.
All right, let's go. Sorry.
Okay. Well, I was trying to say the romantic thing.
I was just being lighthearted. Sorry.
Yeah.
So we were talking about schizoid intimacy, and we were talking about having difficulty translating your affect into the level of the individual, essentially. And so there's another thing I think I want to add to this picture is that people act in the world in extreme ways all the time based on abstractions. And like a philosophical example of this would be Abraham in Kierkegaard's analysis of Abraham. God is telling him that it would be a good idea for him to murder his own son. Right? And then he loves his son dearly, but then he's ready to go and do it. Right. And people
he'll do it.
So now that seems like whenever I bring this example up, it confuses people because they go, "Oh, are you saying that it's good that he was willing to murder his own son?" And it's like, no, that's not the point. The point is that an abstraction can cause you the power of belief to cause you to act in almost any way.
Right. Yeah. I don't want to deny that. Historically, there would be overlap with what people described as Asperger's syndrome in terms of that rigid. Sorry if rigid is derogatory or something, but it's I guess it's having values that you believe strongly in and that are not easily modified. But can you just remind me of the example you just said?
Abraham killing his son.
Right?
No, attempting to kill his son because God spoke to them.
That seems like a little bit of a rigid, maybe maladaptive belief that
dogmatic.
Dogmatic.
Yeah, exactly. But I don't know that that's the majority of schizoids. I think that abstraction is definitely a a key feature.
Mhm.
And I think it would be fascinating to actually look at the abstract verbal reasoning ability of people with schizoids versus other people.
You should definitely do some research on that.
Well, there's a reason I'm bringing this up. There's a reason, and it connects back to the intimacy topic, because if we know that people can act in all of these ways based on abstractions, it becomes quite reasonable that a schizoid could think about the category of human beings, love the category of human beings, and want to act to benefit other human beings, right? And then take that from the abstract level and then instantiate it within an individual that they're in a relationship with, without necessarily being interpersonal in the traditional way. And I think that there's an atypical way of being pro-social that a lot of schizoids don't know is possible, acceptable, not shameful, right? And it takes us a long time to figure out how to express that.
And I want your opinion too.
I am all for whatever works. I think that makes sense to me as working.
Yeah, and bringing it back to therapy, I'm curious to how you think that would be useful to implement as far as like using the atypical, if there is some kind of atypical thinking occurring.
Yeah,
like being able to connect it back to the interpersonal.
Like whatever, she's a person. That's better than not a person.
Right. Well, no, but that's the thing is like you can manifest a deep love by training the circuits responsible for in-grouping and cognitive empathy. You can train that to, and if you happen to be very abstract most of the time, then that's where those circuits are going to go, right? And so then while you may still be in the situation where if someone is asking you, do you love me specifically? Am I your special individual person? Right? It might be hard to answer that question.
No, it would be easy to answer that question. Not hard.
It should be easy to answer that question.
Yeah, it should be easy.
You should feel like a little bit annoyed that you have to constantly, profess your love or something.
But that question is the product of two different factors. One is that there can be people who need to be told that constantly in an unhealthy way. Right?
And that's where I want to go with this discussion.
Yeah. And then the second reason is that as a result of being with somebody who's so abstracted and not understanding that there can be a degree of acceptable difference, the person can feel like they're not loved in the way that they should be.
Oh, totally. They could be like their needs are not being met, or like,
Oh yeah, that happens. I've spoken to a lot of couples, or not a lot of couples.
I mean, I'm not
in relationships.
Not from personal experience.
No, I know, but I've spoken to a lot of Zoids that have been in relationships. That's often been the issue, is that their partner felt like they weren't.
And I think that's where Nancy is right, because she hits on that dynamic. Reportedly.
Because you haven't read it yet.
right. Well, I couldn't find it. I'm looking for that dynamic to cite, and there's not much.
You said you wanted to take the conversation somewhere. Yeah, I want to hear that.
Yeah, just in terms of schizoid intimacy, to emphasize, I understand the strategy of the abstract positive view of other people as being a way to think about intimacy in a positive way, and as potentially facilitating intimacy. But I think it's actually better to be more specific and to be more discerning, and to try to find people who are a good match, because people who with schizoid personalities have so much capacity to really have rich mental lives and are at risk of having that sort of encumbered or inhibited by the wrong person.
Oh, don't scare the schizoids. They're already scared enough to try the thought of a relationship.
To try to get a relationship.
Vomit. Well, most of them think about a relationship and they go because of that very reason you described.
Because of that very reason.
Yeah. One of it's.
Well, I want to tell them
engulfment, right?
Completely or justified and rational to have that fear, and But what I would also say is that no.
I'm kidding.
Also say is that there's an equal proportion of people who have the capacity to be alone, know that if their partner is really into whatever flow state they're into. It doesn't mean they don't love them. It just means that they're, you know, doing what they enjoy, and the other person is capable of doing what they enjoy, and they can come back together to do things together. And being willing to let go of a relationship can be hard for someone with schizoid personality, just as expressing aggression can be hard. And they both go to, you know, asserting sort of the righteousness of being schizoid and the demand to sort of find someone who agrees with that.
Question, and it has to do with relationships too, and I wanted your advice, your thoughts.
But that I'm getting a little bit like loopy on.
Yeah.
So
no, you're good. You're good. You're perfectly fine. I just want your thoughts on something that has to do with relationships, right? Because I've had people on the channel comment on the server that aren't schizoid, but they're in a relationship with someone that is, right? And they're the other person, right? And what's interesting is sometimes you'll have the people that you describe that are okay with the alone stuff, and so thus they give that person the room that they need, but they still are concerned because that person is still displaying a lot of other issues that they can't seem to help them with, like the depression and anxiety and things of that nature, right? But this is what I was curious about. If an individual has atypical values, right? Atypical emotional attachments or whatever that they developed over the course of their life.
Well, what do you mean by atypical?
Well, it's because we're all on my show on this. We're always talking about that stuff as being the abstract.
I know. I guess my goal. I'm saying it's like health,
because that's usually I know, but that's usually what we're saying. The more meta,
I know.
Abstract.
Look,
that's I'm trying to use atypical since you used atypical too. So I'm just kind of working.
This is my fault. I was the one who used the word atypical.
Okay. They started with atypicals because that kind of doesn't just go with just abstract, just whatever. But anyway,
you can be atypical in a number of different ways.
Yeah, I know.
It is atypical. We have to be real.
Yeah.
It is atypical.
Okay. All right.
Okay.
Being abstract all the time is atypical. Or
I could conceptualize that as what's called intellectualization as a defense mechanism.
Different than abstraction, but
okay.
Well, that's a whole. But okay, let me get this question out because I think it's important.
We could table that.
That one. Yeah, well, that's important to get back because that's more theory again. I want more practicality.
Yes, very much so.
Okay, so if somebody's in a relationship with someone that's a schizoid, right, and they have these abstract / atypical whatever types of preoccupations, right, but their partner is obviously having trouble meeting some of their needs because say they're not that kind of they don't have those same values and stuff. What kind of suggestion would you make for that partner to try to reach out to them in their world so that maybe that could create more of a reward system for the partner that isn't preoccupied to kind of want to dabble in theirs as well, like a not quid pro quo, but like a mutual what's the word? Reciprocal sort of altruism, where it's like, I'll expend extra energy to be in your world.
Moving out of your default mode network with the other person.
Okay.
It requires motivation, right? It requires some kind of reward.
Let me answer. Let me try to answer the question. First, I think it's just asking the question is sort of moving because, I like to hear that there are people in relationships who care enough to try to understand what's going on in their partner to figure out ways to connect with them better. What?
Especially if they're neurodivergent, so it's even a bigger hill to climb. Yeah.
Right. There's stupid advice like you could read a book called Solitude by Anthony Storr or something, but that is worth very
reading
little
a book
advice. You don't need. There's certainly psychologists who like read a book, but I would not consider that very good advice. I would say it's important. I'm a believer in therapy as a therapist, and I'm not just saying that. I'm saying it probably because I'm somewhat brainwashed into it, but I believe it nonetheless. And I think that if someone who's going out with someone with schizoid personality disorder is confident enough, brave enough to be vulnerable, and not, worried about what it means about themselves to get into therapy.
Yeah.
That just having that ability to talk about their relationship and their feelings about it is going to make such a big difference in terms of helping them get to a point of better understanding their partner and what their world is like, and tolerating differences.
So schizoid relationship counselors needed.
Tolerate difference. Got
Tolerate difference. No, absolutely.
Yeah, well, the point is get in therapy.
Yeah.
Find a therapist.
So you're saying
I'm not saying no couples therapy, not couples therapy.
Not couples therapy.
Individual therapy for the partner.
So the partner should go to therapy because to help them better understand their schizoid partner?
That actually makes a lot of sense theoretically.
It kind of does theoretically, but I'm not too sure. Like,
if you want me to, I can say it in a more politically correct or palatable way.
Oh no, it's
perfect. The way you're saying it is fine.
It's perfect. It's perfect the way it is.
I'm trying to clarify what you're saying.
That's correct. You're accurate. That's completely accurate. But
why is going to therapy helpful to be able to understand?
Well, let's assume it's a good therapist, or what I mean by good is someone who's broadly based, psychodynamic, not just interested in like curing surface symptoms, but interested in helping the person reach whatever goals they have, regardless of whether those are in the DSM or not, and wanting to understand, what matters to most people, how happy they are in their job, their relationships, their family, sort of as general areas of intervention. And just to help someone understand, psychoeducation about schizoid people can go a long way. It would just build empathy for the person with schizoid, I think.
So you're saying like educating them on the like someone.
It's psychoeducation.
Like you could. So you're telling me that you could have a client that goes to you to talk to you and pays you to teach them a little bit more about schizoid so that they can understand their husband better?
That I would say that would be one component of it. Yeah. They wouldn't say that explicitly, but that would certainly be one technique.
And then help them with their emotions.
Also, would be to help them with their emotions.
Yeah. In regards to being in a relationship.
Maybe it's making their life miserable and it's not for them, and that's okay too.
But, absolutely.
But I do push this Winnicott idea of the capacity to be alone as sort of the indicator of emotional maturity and psychological health. And I think that as a bedrock goal in any psychotherapy will bring people with schizoid closer to people without schizoid.
I'll give another personal anecdote on this subject of schizoid intimacy and the capacity to be alone. And I think so there's literally being alone in the sense of like no one else is there.
Yes.
And then there's being alone in the presence of another person, and you both are not doing anything and not interacting. And then there's being alone because your mind is zooming out to think about how big everything is and how much there was and will be and how absolutely overwhelming that all is.
Whether that's cosmic or whether it's just your nation state.
Okay, that latter one could be with or without someone there.
Right, exactly. And so that's the point. So if you're doing that with somebody else, right, and they may or may not follow you into that state, right? You can be very even if someone follows you into that state, it feels lonely.
You don't want someone following you into that state. You want someone in their own state, leaving you in your own state, and knowing that they're not judging you negatively for that.
The only caveat, not caveat, but the only
look, this is sort of maybe an idealized pipe dream or something, but
no, it's not. It's not necessarily a pipe dream at all. What I mean is that there are times I feel that. Okay, let me think of some positives, some pros, right? If say you have a schizoid partner, right, and if you're panicking over some minutia, right, that schizoid partner could probably help you abstract out a little bit more so that you're not panicking out over something so minute.
Well, the minutia becomes irrelevant.
The minutia becomes more relevant, or at least let you see a bigger picture, right? So that you can relax about it. And then at the same time, if you have a neurotypical partner that isn't abstracting or off into the woods somewhere all the time, they can bring you back down in the sense that it's like, okay, this big thing that you're having a panic attack about, let's bring you back to laying down on my lap, and let's bring you back to me touching your head and petting you and relaxing you and the physical sensations of that, or just talking about the TV shows we watch together.
Yeah,
right?
my guess is that partner, that's their dream, is to be able to do that to their schizoid partner.
Well, I mean, I don't think it's entirely impossible. Like you were saying, the doing things alone but not alone. Like, I would prefer, if I'm having a particularly bad day and I'm laying about the house thinking about how I'm just black pilled as hell, thinking about how awful so much is and everything is.
Yeah,
I'm like crippled by depression. I would rather be laying on my wife's lap while doing that than alone.
Yeah. But when you're with her, you're alone in the presence of her.
Right.
So,
exactly.
Yeah. She doesn't have to interact with what's happening to me necessarily.
But, so here's like
she could just
one caveat to all this is that not everyone has the capacity to be alone.
No,
and that may be true of some people with schizoid personalities.
And I think it's important. That alone
that would be an interesting question.
Yes, he was saying it's an interesting question to think about how there might be some schizoids who do not have the capacity to be alone.
I'm sure there are. I'm sure that is very distressing, but they may be more classified as avoidant.
I was gonna say, I don't think I've met one yet.
I mean, I think that
I'm trying to think of what you mean.
I think
explain.
There could be, in the sense that whenever they come back to the interpersonal equidistant place, immediately they have the fear of being alone, and then they only leave that to be abstracted, right? So it's just if you think about like a gradient, right? The personality vectors which are responsible for causing this constant seeking of attention, essentially, right? Those could be stored equidistantly, and then they leave those behind when they abstract. They come back to them, and so it would look like they would go off and be alone, but whenever they're able to be interpersonal, they're going to seek attention.
Okay, that could be possible. I don't think I've come across that one too much, but anyway, you're getting back to the theory again.
That's actually me, by the way. And
that is you. You're right, that is you. Holy shit. That's why I always make fun of you and tell you the histrionic schizoid.
The thing about schizoid personality, the capacity to be alone, okay, if you've developed that implies basically a secure attachment style, which implies that your view of relationships and other people is fundamentally that, people are basically good. They're not going to hurt you.
Or you're not going to hurt them.
You're not going to hurt them. I don't know. There's a lot of pessimism in the people.
That they're going to be hurt. I'm sure there's pessimism.
Or that the world is going to hurt them, or the world is dangerous, and the world is a sick and terrible place. Like there's a very that's the thing. Yeah. There's a very what's the word? Verb. A strong proclivity toward outgroup or incompetence.
Institutional
incompetence.
Institutional distrust. Yeah.
Categorical
distrust. Yeah.
It means, Melanie Klein, good breast, bad breast. The institutions are bad breasts, Sour milk or no milk.
Bad milk or good milk.
I love how everything comes back to the infant.
Everything comes back to milkers.
Well, I am a psychoanalytically kind of person. But
mommy and me, right?
Yeah. So let's. I was gonna do an anecdote. I didn't get to it, but I'll do it. I guess I'll do it now and continue. It's
right. Mommy and me are one would not be the ideal schizoid idea. You want mommy and me are separate but alone together or something.
Yeah, something like that. Yeah. So when my partner expresses her, interpersonal value for me, which she does on the regular, in the most direct and just happy way.
You mean I love you? Or what?
Yeah, well, yeah, but that I love you can function more of like a reassurance. Going like, oh, are we still in a relationship? Yes. Do we still care about each other? Yes. You can say it. But there's even deeper levels of expression where it's like it's specific. There's specific words. It's not just a casual "I love you." It's like it's even hard to replicate. But the point is that when those most genuine expressions of specific interpersonal care and value are expressed, my reaction is to burst into tears every time. Every time. And so, so why am I doing that? Well, it's because that pure expression of interpersonal value is enough to pull me for a second into that space of mind. And in that second of being there, I realize where I've been the whole rest of my time. And I'm like, oh shit. And then my neurodiversity is crystallized in that moment, and I burst into tears, and then I pull myself together, and then I get blasted out into abstract land again. Right. So that's an anecdote for you about the experience.
Okay, I think I know what you're saying. Though,
yeah.
I think I know what you're expressing.
Well, yeah.
I don't burst into tears, but I know what you're saying. I can spiral into a depression.
Well, you know that it sounds like you have nice partners then, if that's an experience.
Oh yeah, they have a lovely partner.
Well, I think the point is that there's a crucial distinction that needs to be made for these relationships to flourish, and that's that it's not that the interpersonal value isn't there. It's that it's stored in a window which is very small. And whenever that window opens, there it is again. But it's just that window is a small window, and so you only get to see it every once in a while. It's you know,
and it depends. It varies. Some see it a lot more than others. Like I probably see it more than you get a chance to.
Well, exactly. I mean, my equidistant window is just smaller than yours, right? And what is important is that it's okay to have a small equidistant window, and it also isn't anyone's fault necessarily, right? It might be someone's fault if you have traumatic stuff stored at that level, which makes you distrustful, right? Which means that you can't express yourself through that window, even when it is there. That would be someone's fault. We were just talking about this experience of bursting into tears and realizing that you've been gone and that you're back. And it's like, oh, okay. Yeah.
I think, sorry, it's dark. It's a reflection of sort of how moving it is to feel seen when you haven't felt that way, I think. Or to, let the experience of feeling loved and of feeling intimacy happen and see that it's not, totally devouring you, and that maybe it's actually lovely.
Actually, I've heard instances in which that's the reason, just like you described it. Actually, I've had a few tell me that those moments are very powerful for that reason.
Yeah.
Because like they feel like they wish they could stay there more often.
Those are breakthrough moments. Those are beautiful moments, of course.
Yeah, but the difficulties, they feel like I know I won't be able to stay here very long.
Right.
And then they
will be able to, there's hope for sure. I'm going to say, like, you need, if you had a friend who was really sensitive to all this that you could talk to every week, twice a week, great. But usually people need a good therapist to sort of.
Well, good luck finding a good schizoid therapist. There's not that many. There's not that many.
I guess there's not.
There's not that many.
I know, but I believe that a good therapist is a good therapist, and there may not be that many good therapists, but there's a lot of problems with the world of therapy right now that makes it hard.
I think there's always been a lot of problems with the world of therapy.
Yeah,
it's inherent. It's impossible to not have problems.
But that's why what you're doing, peer process group like things, serve a similar function, and that function is to prolong those experiences of what tears of happiness,
feeling really joy or comfort.
Well, that's the thing, is that it was not necessarily, I mean, it is tears of happiness, but it's also tears of realization of what you are and what you've been, and in some ways what you will continue to be. It's tears of it's like tears of compassion and love, but also tears of acceptance and remorse.
Remorse in what, Birb? I'm curious what you mean by that.
Well, remorse in the sense that in the sense that you've got to be in that space for such a small amount of time, and it's not it's not necessarily the consequence of some deep traumatic wound which has closed that window for you. It's the result of it can be the result of a very deep structural difference in the way that neurons are laid out.
Yeah, but I'm sure that's not what's going through someone's mind when it happens.
Well, no, but not maybe not in that detail. But
I think in your case, yes.
there's a recognition of the difference. There's a recognition of the waves you've been riding, and then being taken to this eddy for a few minutes, and then being pulled out to sea again.
Well, the being pulled out to sea is almost a survival mechanism, I think, because it's somewhat destabilizing to be in that state for too long. Survival mechanisms go awry often, but if you're not used to feeling like you're going to pieces, even if it's mixed with positive emotions, it can be scary, and abstracting and intellectualizing is not the worst, defense mechanism there is. And if that's just somebody's tendency, and, it's okay not necessarily to change that.
Yeah, I'm just trying to think, because you're saying it would be a defense from what exactly? What are they defending
from the influx of feeling that positive.
That's where it's confusing, because oftentimes when schizoids, even within those states, within those territories, they have big heaps of feelings and emotions.
Oh yeah.
So there, if anything, they have more emotions there gathered than anywhere else. And I'm talking like, crying, falling apart, all over yourself type feelings.
Totally.
But they're over there somewhere, in the intellectualization or the abstraction.
So you could understand why they'd be very good at intellectualizing.
Oh no, they'd be very good at it, because it's a combination of both. It's like I think I separate those two things, intellectualizing and abstracting, because I think one is intuitive and one could be a defense mechanism when you're talking schizoids.
Yeah, one could just be a cognitive style.
Or rather than them being two different things, it's the same mechanism, but from a different perspective in a different kind of person. So look, like the classic scenario is somebody has an experience that is extremely traumatic during their childhood, and they go to a different place to escape from that experience, right? And my point has always been that place had to be there to begin with for them to hide in it. If there is no cave available, you don't get to hide in a cave, right?
And
what do you think of that, Doctor?
I think that's a beautiful
cave analogy. Yeah.
Right.
Well, I love the cave analogy.
It
reminds me of the Paul Simon song. Like, I'm like a rock. All I need is my books and whatever. I don't know if you guys like Paul Simon.
I can't hear you quite well.
He's talking about a Paul Simon thing.
Oh, Paul Simon.
Yeah, no, I mean the idea of the Paul Simon song. He's an island, and he's safe on the island because he's surrounded by his books. And he doesn't need any people, and it's a safe cave for him to, not be harmed or whatever the fear is from the interpersonal world. And I think truly everyone needs to have that cave. Without that cave, nobody could ever, replenish themselves or get in touch with themselves.
I think the difference is schizoids live in the cave.
But schizoids have a bigger cave.
They have a bigger cave and they live in it.
A better way of saying. Sorry.
Yeah, so they should, the cave should decrease but not disappear. I mean, I guess logically or something.
Yeah. Well, I mean, so we've established that some people have the cave and other people don't. And so that also means that some people have bigger caves than others, right? And so like if 80% of your world is cave, then the chance that if something mildly annoying happens, that you will go there is much higher, because it makes up a larger percentage of your available world to move.
Totally. And, you know,
yeah.
When I was in grad school, you know, we had all these words for it. So it's called, like, you know, isolating. For some reason, you know, we just made it a little bit playful. I mean, because I did it a lot as a coping mechanism, would isolate. So I don't know, using humor or something to be playful about some of those tendencies can be okay. But I understand there's a very, you know, serious, sad element to it. And isolating, while it may sound funny to somebody, you know, while you're doing it, it's incredibly depressing, and you know, it's unbearable at times.
I mean, it can be unbearable, and it can be unbearably beautiful, you know?
Yeah. I mean, some of the best aesthetic experiences I've had are in those states, in terms of appreciating film or television specifically.
Or in the case of somebody who's deeply schizoid, you know, jumping off of film or television and reorganizing the categories from the, you know, and then living
just in their own thoughts and their own internal world and stuff.
Oh,
yeah. But I mean, the point really here is that there's a deep neurological difference which is responsible for these states, and so, you know,
I would say it's not just neurological. You know, you brought up trauma.
Well, yeah, it was both. But then the permutation spreads between the person who had a very small window, this cave analogy, a very small cave, and then they were forced into a very small cave by a very aggressive bear. Right. And then there's other people who have this massive yawning cave that you couldn't help but fall into. If
you get lost in. Yeah.
Well, and then a bee flies behind you, and then, oh, what's a bee? And then you fell in. Right. And so this analogy of bursting into tears is like finding your way out of the cave for a second and seeing the sunshine. Right. And then going, oh, back in the cave again. Oops, you fell in again. Right.
Yeah.
Okay. Yeah. So one thing is to make the cave more enjoyable. Another thing is to you know, decrease the need to go back into the cave and increase you know, bringing someone else into the cave with you, or going into somebody else's cave, but
right?
Maybe avoiding people who don't have caves at all.
Yeah.
You know?
These are all great suggestions.
No, I'm curious. If could you elaborate a little bit further, Doctor, on what you would say? What would be a good two things? What would be a good way for a schizoid with a big cave to learn how to go into other people's, and also what would be useful for them to make their own cave as comfortable as possible, so it's not, you know, dark and dim and damp in a way that they don't enjoy? How do they light up the place? How do they make the place more comfortable?
You know, a big part is interpersonal, and who you're living with and their approval or disapproval of your lifestyle. I mean, you could have, you know, a sick setup, but be totally like hated by your family, or they think that you're rejecting them. And then that cave, it's still pretty shitty. So I think at first, you know, there has to be, at times there needs to be a family level intervention that can be helped, you know, with a coach or a therapist. You know, I'm trying to figure it out right now. And, you know, there are plenty of girls with schizoid personalities.
Well, there's a few on our server, so I know.
Yeah, I don't know. I mean, yeah, but, you know, it's her cave, the quality of it will change dramatically depending on her family's attitude towards her being in the cave. So it's then on me or the therapist's job to figure out how to convince them to let her be in the cave.
That's great. That's fantastic. Yeah,
it's not easy, but that's very challenging.
Well, that's what's interesting, and that's what's really scary for a lot of schizoids, is that they think they're going to be grabbed by the legs and pulled out, and by their therapists or by the institutions. They think they're going to be dragged out.
That's like the worst thing you could do.
Yeah, but that happens all the time, unfortunately. Especially ones that are ignorant on the subject or don't understand what's actually happening.
Yeah. Well, look, there's a lot of, I'm going to use a really wishy-washy term or something. There's a lot of epistemic injustice in connection to seeking psychotherapy. Okay?
Just say what it is.
I mean, like, you know, I grew up in New York City. My parents are both shrinks. I could find a shrink in any city. I just know how that world works, and I would know how to find a good shrink. How many people have had that situation? Most people, you know, wouldn't have the first clue of deciphering a good therapist from a bad therapist. That's not an insult. It's just a, you know, a shitty fact of the way.
Any profession, you mean?
Yeah.
Yeah, any profession at all. There's a shitty mason and a good mason. You know, it's the same thing.
You're right. Exactly. But there's a lot of mason therapy. You know, there's tons. And
there's a lot of masons that could build a pretty house that collapses under any under any stress, right? And
the fact that there's so many who are so clueless as to think that they should just, you know, start confronting this, you know, social withdrawal or isolation.
Normalizing them, as they might want to call, normalizing their social behavior, make them like, because I've heard so many stories,
trying to force them to be, you know, normal.
Okay,
well, let's pause right here, because like, when a lot of schizoids hear the words defense mechanism, that's what they interpret.
Yeah,
they hear the words defense
mechanism. I'm glad you brought that up.
Yeah, that's kind of why we give you a little pushback on when you bring defense mechanism thing, is because that's kind of one of the complaints I hear is, okay, let me just give you an example. I've had schizoids tell me that they go to their therapist,
and they tell them it's a defense.
Yeah, and they diagnose them schizoid, but they keep telling them, oh, this is all to keep you safe. You're trying to be safe from the world, safe, right? And the person tells me in DMs or on the server, they say, I don't feel unsafe. I feel misunderstood and alone and alienated. I don't feel like I'm in danger. Why does my psychologist keep thinking that I'm doing this to be safe?
Well, hold on just 1 second.
Come on, I had a good one going, Birb.
Sorry.
Do it, Birb. Go.
Sorry. Anyway, I was just going to say that this really ties back to what we just talked about in terms of sometimes it is a defense mechanism, and sometimes it very much isn't. And we need to be aware that it can be both one or the other.
Yeah. And I want to add some other nuance to this, okay? And that's how defense mechanisms work. Despite the name and whatever that conjures up, they exist on a hierarchy, going from, you know, the labels have changed, but I guess the most PC version is maladaptive to neutral to adaptive defenses. So people with adaptive defenses, that's what being high functioning and having mental health is. So the word defense mechanism is definitely not necessarily negative. In fact, it's a positive goal to increase use of, you know, adaptive
defense mechanisms, healthy versions of those.
And one of the adaptive defense mechanisms is intellectualization. One of the maladaptive ones, you know, is like isolation. So there's some.
But you want to know what's something funny though? Even intellectualization can be maladaptive. Like, for example, in a relationship, especially, the dismissing and the discarding of other people's feelings because they're not you intellectualize the situation to the point where those emotions become irrelevant and discarded.
Yeah, of course. No, I mean,
that happens all the time to people. Schizoids always get in trouble with their parents, with their partners, with their brothers or sisters, because, you know, one of them tells them, I'm really sad because this person died, and then they think
it doesn't matter.
Well, I mean, they go, how well did you know them? Oh, I met them a few times. Why do you care? You met them a few times. You don't know anything about them. That doesn't make sense. No, they'll be like, you don't know anything about that person very much.
I gotta tell you,
and like,
I have to tell you, it doesn't make sense if they.
But to a lot of people, it does make sense.
No, but I'm saying you have to. You know, I think it's important that schizoids respect their own judgment on some things.
Okay.
Like there are some things that actually don't make sense.
But the judgment, I'm not saying, see, this is where it's important. I'm not saying that the judgment itself is unsound, right? Yeah. I'm saying that discarding that person's feelings and just throwing them to the curb instead of trying to understand where they're coming from.
Melodramatic person, who needs to hear, like, I'm so sorry that the person you met twice and have no idea their last name passed away.
Hold on. Let me help. I can help.
Funny. All right, go for
it. Sometimes
maybe I chose a bad example.
You did. Sometimes it's not necessarily that the perspective is wrong. Mm-hmm. Sometimes what it is that based on
I understand the social skills are not working to communicate effectively or something like that.
Well, no, so sometimes what's happening, or I think most of the time what's happening, to be frank, is that the stress involved in everything that we've been discussing closes in one's ability to hold somebody else's interpretation in their mind at the same time as theirs. And so you get a situation where, well, I'm abstract and I don't care about these things which seem trivial to me, and so I dismiss them, right? And then that hurts the other person. But from the perspective of the person that's having difficulty nesting that context, the other person's perspective doesn't matter or doesn't exist. But then as stress diminishes and they're able to consider more, they go, well, just because their perspective is different doesn't mean it's wrong. Just because their perspective is different doesn't mean that their suffering is not important
or invalid. It's the invalidating of other people's emotions.
That is such a good point. Yeah. That is such a good point. And it ties into something I was talking about on Twitter called ego depletion theory, which is when you're depleted, you don't have the space to mentalize other people's states or respond to them in a way that's effective. You're just going to go on autopilot to your default mode of whatever that response is. So I think it's such an important point that you make. And one way of, trying to mitigate that is to increase like self-care so that you feel, rested enough to be social when the time calls for that.
Increase working memory. Yay.
Yeah. I mean, I would disagree. Yeah, I would call it as working memory depletion.
Yeah. It's the same kind of concept.
Yeah. Same kind of concept. Yeah.
Like when you're tired and you're exhausted, you don't give a shit about much.
Well, it's more than just exhausted.
And stressed. And,
hyper, like with lots of energy and excited. It shrinks in as well, right?
Even
manic, it shrinks in. Yeah.
Yeah. And then suddenly,
I'm not sure what the disagreement is.
There isn't.
We're not having one.
Yeah.
Were we having one? I wasn't sure.
No, I have problems with anger, so I can't tell.
Oh yeah.
Oh, okay. I'm so angry. I'm so angry right now. Yeah. Anyway. You're being too passive.
No, it's just agreements, not disagreement.
You're just agreeing with us because we're.
I thought you didn't like the word ego depletion.
Oh no! I was just contrasting the different words used to describe.
Your word sucks, Winarick.
Working memory is a great ego function. It's like a prototypical one. So
it's just funny. You thought we were going on the attack on your terminology?
Your word choice for the thing we both understand.
My word choice is better than your word choice. Your word choice dumb. Mine's smart.
That's psychology in a nutshell.
Yeah.
That's language.
Language. Yeah,
language. All the fun language stuff.
I guess one thing. So I hope. Just to reiterate, everyone uses defense mechanisms. You wouldn't be alive if you didn't. It's a process of cope. There's coping mechanisms and defense mechanisms. Coping mechanisms are conscious attempts at dealing with, upsetting shit and difficult situations. Mm-hmm. Defense mechanisms are theoretically unconscious and they happen automatically. It's like you default isolate without really being aware of it.
Yeah.
Yeah. And
reflexive.
They vary in how adaptive or maladaptive they are. And in the scale of, adaptation, some schizoid defenses are maladaptive and some are adaptive, and it can vary. And therapy that seeks to address them should not just pinpoint this one caricature of a defense mechanism as just, a need for safety, but to really take into account that there are these different levels of defensive functioning. At each level, there are different defense mechanisms. And to reduce the entire thing to, a pop psych concept is certainly not helpful to someone who is prone to intellectualization.
I think the reason that the term defense mechanisms can sort of rub some schizoids the wrong way is because it does allude to a reaction to something that happened rather than something that is who I am, right?
No, but that's not what it means. It's
I know,
not.
I know,
yeah.
but you have to understand.
Well, then that's good.
Words,
That's good. That's why we're having this conversation, so that somebody that's a schizoid out there
defense mechanism categorically do not imply trauma. Okay, they just don't.
Yeah. Well, yes, that's true.
They imply you got to figure out a way to live in a world that kind of sucks. And everyone does.
And it just extra sucks for schizoids. Just a little extra, at least
it
in
sucks
some
in
regards.
Different ways. Schizoids vary. Well, and they're,
they vary.
I keep repeating myself that, there are these healthy components to schizoidia. They're unhealthy. Like the capacity to be alone is the, pinnacle of mental health.
So maybe we should be
to
teaching
have that
people how
one
to
in
do
the
that.
bag is quite good,
Oh yeah, I mean that's true. Maybe we could teach them how to do that, and they could teach us a little bit of that whole like being able to enjoy another person's company
right
to some degree.
I think if you can find someone who can also have the capacity to be alone, that becomes enjoyable, and you are in that person's company, even if you're not interacting. And at times you will interact, and at times you won't. But it can be hard. I mean, what Nancy McWilliams' point is that there is this tendency for histrionic women and schizoid men to be attracted to each other, which is obviously the worst combination.
Send me the link to that if there's any way I can access that.
I mean, that's what my dissertation advisor said, so I assume he's right. That's what she said.
Well, send me the link. I want to see it. I'm going to pick it apart and then call you out.
Do it.
I'm just kidding. I'm not going to do that.
Then we'll discuss it.
No, I just want to read it. Honestly, I'm just curious to what you're.
Well, then you can
specifically.
Tell me about it. I don't have to read it.
Okay, well there you go. Do you want TLDR or what? You have piles of books, but you won't read an article.
I have read it. I've tried. I guess I don't like it. It's obviously this is an unconscious.
No, I get you. That's fine.
But
just Audible. I should get an Audible sponsorship right now.
I don't know. It's too pop psyche for me, and she's worshipped as the guru of psychodynamic personality.
Stop projecting, all right?
I know.
That's not what we like to do.
sorry to waste time. So I guess I do want to address the trauma thing, though, that people obviously don't like to be accused of having some trauma that they're defending against and having to be saved. And I think that's true, but I also think that sometimes there are traumas, but they may not be in the same. They might not be what you typically think of as a trauma that you don't want to think of yourself as having. Traumas could be just not having the experience of someone who allowed you to be alone in their presence. It could be someone who never allowed you to be alone in their presence. That in itself is a trauma, because you don't get to form a self.
I would argue that it's especially traumatic in a person that has this proclivity toward this schizoid personality. It's going to be especially traumatic. It isn't necessarily the personality. I don't feel is necessarily indicative of that particular form of trauma, but I can definitely imagine it would entrench someone even further later in life if
it would make it much more severe.
Well, I think that it can conjure up, this conversation can conjure up that fear of being dragged out of the cave, so to speak, in the sense of, well, if the fact that I'm made up mostly of cave is a response to not necessarily even something incredibly traumatic that happened, just a response or a reaction or a defense against something, not necessarily traumatic, then that means that that it wouldn't have been that way unless that something had happened. And I think it's really important because what schizoids don't get is acceptance of them being themselves in their own unique way, as we've just been talking about. It's like, you know, parents are always concerned about how they're not meeting the expectations, they're not getting the same goals, they're not coming out of the
they don't have the right values, they don't have the right priorities, they don't have.
And so I think it's really important to stress, because it hasn't been stressed, that this is a deeply human and acceptable way to be, and it doesn't necessarily have to be a defense against anything. It can be, right? It can be, as we talked about the analogy, but
everyone uses defenses, but you're right. That doesn't mean that personality is a defense. You know, it just means they use, like everyone else uses defense mechanisms.
Well, I mean, that's just so nuanced, right? Because it's important to go, well, yes, it might be a defense mechanism for you to go there, but the fact that that is there is not a defense mechanism. The fact that place for you to go, right? And that's a distinction.
No, but I would say, look, maybe we need a different word, but the fact that their place is there to go is an adaptive defense mechanism, which anyone would strive to want to have, especially someone who didn't have that.
Well, you're saying helping someone make a cave. Yeah. Okay. Like that they can actually be comfortable in, that wouldn't necessarily possess one. I think that's something that's definitely possible. But I think when you're talking about somebody that's, I guess, schizoid, it's an entirely different thing. It's I believe that cave was already there.
Well, yeah, that's sort of the point, is that like you can condition somebody to develop something that looks similar, but for the schizoid, it was like bang, boom, cave. I fell in.
I've had my cave since childhood.
Like 4 years old. We're talking.
Yeah, I've had my cave since like I was really little.
Yeah. And you don't want to ever think of that cave as an adaptive defense mechanism.
Well, no, adaptive, sure, but as a reaction to something, no, it wasn't a reaction. It was just a part of me
that's where I grew up in the cave. I am in the cave. I'm part of the cave. The cave is part of me.
And so when someone says, "Oh, that's a defense mechanism," it's like, no, but that's so much of me. Like,
that's a misunderstanding of the definition of a defense mechanism. Is a part of you. It's a part of everyone's personality. That's the definition.
But it still implies
that it's a reaction to something. Yeah.
That's what the thing, and I think that's the issue. A lot of.
But you think it's not a reaction? It's a reaction to being a lot. I mean, if you didn't have defense mechanisms, you would sit there and do nothing.
Okay, here's a better. I got a better way to word it. Let's. Okay. Is everything about what is understood to be typical human behavior all a defense mechanism?
All of human, it's not just defense mechanisms, but defense mechanisms are relevant in describing the personality of every human.
And so like that's the thing. There's a lot of behaviors that aren't shared between schizoids and other people, right? That aren't shared, certain kinds of proclivities, motivations. A lot of the stuff that's understood about general human motivation and behavior is not relatable to a lot of the schizoids that I communicate with, right? They go, this is relatable. This doesn't motivate me. This doesn't make sense, right? So this is not a reaction to something.
I wouldn't even call that a defense mechanism. But that doesn't mean
that's
they don't
the
have
differentiation.
That's the cave.
That's the cave a lot of the time. The cave is just where we are. It isn't necessarily where we went. We didn't go there.
When I think about a defense mechanism, what I think about is a move across a territory. And what we're trying to distinguish is that the underlying territory is not the same as the move across the territory. The layout of the landscape is not the same as, oh, there's something going on in this part, and I'd much rather be in this part right now because that's no good. Right?
In my opinion, a defense mechanism, it just means that you're engaging in a process of adaptation. Doesn't necessarily mean you're responding to something negative.
No, it doesn't have to be negative. I mean, there's some stuff about human behavior that is not a response, right, to something.
That's not a process of adaptation. Yeah, of course.
Yeah, and that's kind of what we're trying to.
So the question is whether this is a defensive function or not. It can be. It doesn't always have to.
That's where I want more research.
Exactly, right. Like that's the point. Is that it can be, and often, it always is a defensive function in the sense that you will move it. in that direction in response to something. You will adapt in the moment or across a week to move into that direction. But the underlying landscape or territory, right, is distinct. It's not, the underlying landscape is not a function of reaction to something happening, because there are innate differences, right? And I think that it's important.
Yeah, of course.
It's important that we highlight those, because the legitimacy and value of those innate differences for schizoids is not being stressed at all in the general culture, whereas for things like autism, it is, right? And we see that there's a huge benefit in terms of making that distinction for autism, but for schizoids, that hasn't been done yet, and it needs to be.
Yeah.
Wait,
I think it's a language issue.
Can you say more about that distinction that's in autism that needs to happen in schizoids?
So the distinction in autism is that the core symptom set of the hyper concretization, the special interest, the unique sensory sensitivity to the environment, the unique styles of behavior, those aren't reactions to stimuli. They're not adaptations. Right. They're adaptations evolutionarily if you go back.
That's what I was gonna say. You can argue that
they're adaptations to the era of adaptation in terms of the ancient history, but they're not adaptations for the individual. They're the starting landscape, right?
And that's kind of what we're talking
because
about.
Generally people think about autism as like so neurological that it's like
right. But that's the thing about autism, though, is that it's on a gradient from neurological and predispositional, and at one end of that gradient you have a person who is so weighted in the direction of predisposition that it's just what I'm talking about is clear. And the same is true for schizoid, right?
And I'm not just talking schizoids, by the way. I like to advocate for the idea. That's why I often bring up that schizophrenia spectrum.
Schizophrenia spectrum.
That's usually the term I like to use.
And so that sort of distinction that has been so beneficial for autism, because it's caused people to lay off with the pressure to change them, right? Because it's not a reaction to something. It's just who you are, and it's okay to be that way.
We don't tell autistic people that their behaviors or proclivities or interests or cognitive differences are a defense mechanism.
Well, some people do.
Some people do say that, right?
People do.
And I think that's a mistake.
Honestly, you just acknowledge that sometimes maybe they are.
Sometimes maybe they are, and that's important. You have to have these permutations and possibilities open for each person, right? And each person in which situation, really making that distinction of what is the territory and what is a move across the territory in reaction, right? And having that distinction, I think, is important.
I don't know what you mean by move across, like this movement.
Well, well, I guess I think visually. So I'm imagining the landscape of these innate differences, right, which can scale up or scale down. I'm imagining that as the territory, and then I'm imagining a defense mechanism as a move. So let's say that I'm having a conversation with you, right, and we're talking equidistantly about my relationship with somebody or our relationship and how we relate to each other, and you say something that makes me uncomfortable, right?
Right. And then you engage a defense.
I might engage a defense mechanism, which is to move into my comfortable abstract space, right? As a reaction. That would be.
But you're thinking that is distinct from whatever genetic predisposition you have. And defense mechanisms have a genetic predisposition.
Well, I'm actually not thinking that it's distinct. I'm thinking that there's a distinction between the movement and the size of the territory that you're moving into. Right? Just like how in autism, there's a gradient from my environment has emphasized these traits to these traits were just so prominent from the beginning. The same gradient exists within schizoid, right? And so you might notice that as a result of something going on in the environment, the person is being pushed more into that territory. I'm being pushed more into my special interests. I'm getting more sensitive to stimuli. I'm avoiding stimuli that is uncomfortable, right? As a result of what's going on in my environment, right? You can notice that movement across the territory and also notice the territory and not say that the territory is also a reaction, because it's often not.
Yeah, it's funny too, because there's situations, right, in which a schizoid's proclivity to be in their cave, or their intuitiveness to be in that cave, we often describe. There's times in which I see something scary in the cave, and I run out. So there'll be something in my cave that terrifies me, like existential dread. what is it called? Some kind of mortality anxiety, right? Or death anxiety, or all sorts of really abstract ideas that could cause me a lot of distress and fear. And then I might run out of my cave temporarily just to like ground myself to something that's less like I don't know, my video game or something, or
I have the same
my fiction book, right? Like I'm gonna it's like I can't be in my cave
and you're
right
gonna
now.
hate me, but so I would call that behavior an adaptive defense mechanism.
Well, he's agreeing that.
I agree with you. I'm running out. That's the thing. I'm running out of my cave, right? But what I'm saying is that
but sometimes running in is also
right. Exactly, and so it's movement across the territory.
But we're usually in our cave, like on an intuitive level.
Yes, if you're in the cave all the time and you're unhappy in the cave, and you're having trouble getting out, and you would like to get out, it's saying it's a defense mechanism is not that useful in that context necessarily.
What super sucks though for a lot of Zoids is that if there's something scary in our cave, in our abstract world, and we run away to, I guess, the equidistant, we get there and then there's scary shit there. And then it's like, oh,
we're
fuck.
We're stuck in this, like, we're like stuck between, like, which way do I go?
Well,
like,
it's all scary. Yeah. It's all scary because you're either alone in your cave and when the scary
you want to find out what happened in the cave.
But you wish you were someone in the cave to fight the scary thing with you because you want to remain in your cave, but sometimes the cave is scary. But but you can't fight it alone, right? That scary thing in the cave. But you want to go back there because that's where you're comfortable. Sometimes there's scary things out there. The problem is when you run out to the outside of the cave into the interpersonal world, there's still no allies there either.
And
you know what I'm saying. So you have no allies anywhere. Like, and it makes it that much more difficult.
Yeah, I mean, I wouldn't say there are no allies.
No, I'm not. Yeah. It just feels that way. I'm saying that's how it's described. The feeling is described as I have no one in any of these places, right? I have to face my own internal terrors
honestly
alone.
I've never thought that defense mechanisms were the best way to conceptualize schizoid personality. It's just sort of what you have to do. Well, so maybe
something to talk about, yeah.
It's something to talk about, but there's social anhedonia, there's empathy, there's internalized shame, there's rejection.
We just need more research. We need more research. We need more studies. We need more research. That's all there is to it.
Yeah. And, I think, like, I don't know. It's, to me, it's too bad that people with schizoid feel like it's, they're not being understood by therapists who are saying that this is a defense mechanism. Like that, it's now plaguing me as a problem that I feel like I need
angst. How often have you encountered that? In terms
constantly. So constantly, I have this. This is the basic scenario. I went to so the two normal scenarios, the issues that come up with is I went to a therapist. I think I'm schizoid. I explained to them this stuff.
But you gotta usually the therapists, they're not gonna have any clue even.
That's the thing. Or I think I'm this, but my therapist doesn't know shit about this.
Yeah.
And so they can't help me. So that's a common problem. That's common problem number one.
But the next
common problem number two is my therapist does know about schizoid, but my therapist thinks that it's all a defense mechanism. Like I'm schizoid because of either trauma or because of this or that, and it's a reaction to this, and that all my thinking that's like all abstract or weird, or my weird idiosyncratic thinking, it's all just me intellectualizing everything in order to stay away from my true feelings, which are interpersonal.
And then there's the fear of being dragged out.
So I get that interpretation, but it has to be a little bit more specific. Like, what are the true feelings that are supposedly being defended against?
Yeah, well, they're saying that, you actually are defending yourself, like say parents, right? You're defending yourself against all these negative emotions you have about neglect and your parents not taking the time to understand your hobbies and interests, and you're so angry with them and so on and so forth. And so that's why you've, intellectualized the whole situation as being irrelevant to that your parents are relevant, or your relationship with your parents is irrelevant to you, and all this sort of stuff. Like
I see.
So they'll
they,
take,
they don't
that's a
feel
very-
they don't feel
and,
heard.
and then
Yeah.
it sucks because then the person, I talk to them and they go, well, the reason I don't connect to my parents isn't because I hate them. I just don't understand them and they don't understand me, and I
Well,
don't
let me
feel
clarify.
anything.
Let me clarify that quickly. It's not
Yeah.
necessarily because I hate them. It's like, look, the reason I'm quote unquote intellectualizing is not because there's some feelings that at the
I'm hiding
interpersonal
from,
level that
yeah.
I'm hiding from.
Yeah.
It's this is who I am, and I want to be understood. The reason I'm here and having trouble is because, as we've talked about, they don't understand where I'm going or why I'm going, and they don't think it's okay that I ever would do that.
Dude, I'll tell you right now, there's a lot of Zoids out there that have, and I'm not saying if you're one listening, you're one of them, obviously, but I've spoken to a lot of them, diagnosed and otherwise, that have explained that that's the kind of, that those thoughts are the kind of thoughts that keep them up at night, that that don't let them sleep. It's knowing that they're going to wake up the next day to a world that just is not going to understand them, and to family members that aren't going to understand them. Sometimes a therapist that's not going to understand them, to a partner that might not understand them, to a job, to a society that doesn't understand them, or even attempts to try to understand them on their playing field. And
and also, squandered resources, like knowing that you're intelligent and that you could do things, but that you have these fundamental differences in the way that you need to behave to be comfortable and happy, and knowing that no one around you in any of these environments is gonna account for those in a way that you could be useful, and so then feeling useless.
Yeah, they're not going to leave you alone at work for you to do your job that you might be good at. They're gonna,
that's where choosing a job that fits a solitary lifestyle is a good idea.
But this is the problem. What if your passion doesn't lie there? Like, let's just say someone is a schizoid that is particularly connected to, I don't know, marine biology or something.
You could use me. You could use me as an example.
Okay, Birb, go ahead. Well, but say they want to do, they have to do a certain type of research. So that means they have to go to college. And that means they have to get a job. And that means they have to do, is it a bad example? Okay, what's a good example?
Yeah, because most high-functioning schizoids are doing research in college because of the solitary nature of it.
Okay, well, Birb, you give me the example. You said you had an example. I'm curious.
Well, look, so I mean, we're talking about high functioning, but a lot of them aren't high functioning. And when you're not high functioning, just the idea of going to school or interacting with an institution can be petrifying. What you want to do
for me, it was angry. It would anger me that I had
what you want to do is you want to stay in your room and be on your computer and do all of this research by yourself.
Yeah, but you can't become a marine biologist without going to get the degree to become a marine biologist.
Again, I have to relate it back to
one thing
autism.
about school is it does some, it's not the worst environment for schizoids to be in.
Oh, I don't know. I don't know about that one. That's a whole different can of worms.
Yeah,
that's a whole different. I know plenty of schizoids have gone to school and they hate every second of being in class, even if they enjoy the topic.
Well, I mean, you can still pass classes without going.
Well, I think we're moving too.
It depends.
Yeah, we're moving too much into school in particular. I mean, we already talked about how the expectations of parents and all that. But look, on the topic of school institutions, for the low functioning ones, institutions are very difficult for some of the same reasons that they're so difficult in autism. So what will happen in autism is often you'll have a person who becomes very good at a very specific thing and has no interest or capacity to do anything else. And because of the generalized nature of education, essentially forcing them to do something that they cannot do, right? Just by the nature of how their minds work. And so that is so petrifying that they just stay by themselves, becoming an expert in that tiny little field. And then no one knows or cares or will listen to them because
even if they have contributions, no one's going to listen to the contributions. They're going to be lost in paperwork and time.
Yeah.
And I think, and that's the thing, like there's certain types of activities and there's certain types of assignments, there's certain types of work, and the way the work is conducted that is so counterintuitive to someone that has a different form of thinking, that it actually becomes a almost impassable barrier unless they're more high functioning like me. I'm very high functioning, but that's because I don't know, I have a high tolerance for discomfort maybe. But I hated every second of university, of uni. Like, I got my master's and I hated being in classes. I hated the conversations oftentimes were just too restrictive. There's just not enough chaos happening in the conversation. There's just a lot of the way that the system is structured. Yeah. The assignments that are being structured, this is your assignment, these are the things you can work under, this is the categories, and it's like, oh, but there's all these million categories and there's a million things I could work. Oh no, that doesn't fit into the mold, that doesn't fit into this idea that we're trying to convey here in this particular class by this particular professor that has a particular idea about how a certain thing should be structured or understood, and then so on and so forth and so on and so forth, and it just becomes like a fucking trial, man. Like,
hold on a second. You also have to think about like the normal societal expectations. They're not designed for specialized brains. It's like the idea is, well, you can't just go into your room and self-study this stuff for 15 years because otherwise you will die of starvation, right? But
there's that.
That's what their brains are designed to do. And so they're like, okay, die of starvation doesn't seem so bad if I can't do that, right? Like,
I know a few that are like that. That's why they can be very intelligent, right? I've met schizoids that are very intelligent, very capable, very skilled, having graduated high school, having graduated high school or never attempted to go to college for all the reasons I described, institutional concerns, all kinds of stuff, right? Or social concerns as well, and also don't like how do I explain this? They're more capable, they have a more nuanced understanding of the very topics that their peers who have a degree might not necessarily even have the same.
I mean, that's just me. I never graduated high school.
And then that makes them angrier, and that makes them more alienated because it's like, oh, great, I have to function under this system of social devices and things that aren't intuitive to me, and because I can't function under them properly, I can't be recognized. Or
I think maybe we're talking too much. I think maybe we're
God damn it.
Yeah, we went
damn it, Birb. You're supposed to stop me.
I think, one way of helping with that situation is to help someone who's schizoid be more assertive and more aggressive in the sense of, this class, fuck this class, I'm not going to do it. I'm going to find a class that works for me, and I'm going to be really aggressive about going about getting that and setting that up for myself. That's hard to do. And obviously for someone who has trouble expressing aggression and doesn't know what to do, but that is within the realm of doing, especially if you're working with a therapist or a support group of other people.
Up your ambition. Just do it.
It's not upping your ambition. It's upping your entitlement.
Oh, I think people do that a lot already.
Well, what I'm saying is I think schizoids maybe would benefit from that in a school environment.
I'll tell you right now, Butch would run in the other direction if they heard, hey, you want some more entitlement? They'd be like, no.
I'm talking about entitlement to do whatever
basic
independent project that they want to do.
Okay. I thought you were talking about something. My bad.
No, entitlement is just the idea that you have a right to do what the fuck you want to do.
Yeah, it's the positive use of the word rather than the negative use.
Oh, okay. Okay. Well, that was my bad. My misunderstanding.
Yeah. Well, self-analyzing just for a second. It's like much of my reason for never going near any kind of educational institution was that sort of that abstract. Two things, right? The fear of generalized education being pulled into things that would be completely irrelevant and that I would struggle with and be miserable at because the system wasn't allowing me to specialize when I was ready to specialize. I think that's often the case, is that schizoids will abstract up, find something that they really care about, and that's all they want to fucking do. And then the system does not respect that in any way, right? They're dragged through the mud doing all kinds of things that they're just not cut out for, and by the time they're done, they're so
not to say that they can't do it. They can do it. They can be competent at it, but it's just unrewarding.
Well, the thing is that I don't want to, if you scale that up enough, becomes the same thing as I can't.
Yeah.
What I'm
It really does.
suggesting is that, you know, sometimes when you tell the person who's telling you to do those things, you know, I'm not going to do it, I need to do something else, sometimes that's going to work.
Sometimes. Oh man, it's
sometimes.
a whole can of worms. We gotta talk about it another time.
Yeah.
It's such a can of worms, and that's a whole different topic right there. Like, what is it to be? That's another conversation, which is what is it? How realistic is it for schizoids or schizos in particular to be assertive about their idiosyncratic beliefs?
Well, I think there's
like how realistic.
To me, that's a major. That would be a good goal of therapy, right? For
like, but how realistic is it, right? And the problem is a lot of schizoids get super black-pilled. It's super just nihilistic.
I know. Look,
because they're like, oh, none of my, and that's part of the reason they become so passive, is because they had a history of these were my thoughts and values. I expressed them and it failed.
And nobody did.
It failed and no one cared, whether they were a child or a teenager or whatever. And they get to a point where like, why do I fight? It doesn't matter.
Yeah.
Nothing listens.
Right.
The world doesn't listen.
As someone I know, you know, he has the belief in himself that he's competent and capable, right, of doing stuff. Mm-hmm. But it's just like, I don't really care to try and get in that situation. And so, but what helped him was a basic sort of knowledge intellectually that getting in that situation of, you know, the job that he would be competent doing that would be good enough, you know, was the right thing to do in terms of moving his life along. You know, he didn't have any you know, illusions about, you know, some great happiness down the road, but it was like, you know, good enough or something. Mm-hmm. And the way he got there was a slow road. I mean, it wasn't just me that helped him. He went to a career coach and,
you know,
but it was, you know, we've talked about executive functioning and working memory problems, you know, and those are, you know, they can be real. And those can be encumbrances, and those can also be remedied somewhat, you know, directly, and certainly in an emotionally non-threatening way. In terms of, you know, all right, apply to this many jobs on LinkedIn. You're gonna have to do this interview, and the person's gonna drag their feet, and it's gonna be a nightmare. But, you know, at the end, people can pull through and get into a different place. Not that that's the goal of life, to like reduce your miseries a little bit, but I think over time it builds you know, it's nice to know that you can earn a salary that supports yourself and get out of your parents' house or whatever.
Yeah, Angst, I'll let you go. Angst, do your thing.
About what?
About this, whatever your response is.
No. You can go ahead if you had something.
No. I was interested in what your response would be, just like your perspective of how draining equidistant concerns can be.
This is like, okay, so, oh my God. And by the way, I want just a thing I want to say to anyone that complains about how me and Birb talk too much or whatever, and then we don't let our guests talk enough or something. You know what? How about this? Our guests should be more assertive.
Yeah, well, maybe don't have it. You know, guests.
Yeah. No, I know. No, what I'm saying is that, like, but okay. I see what you're saying. Yeah. I like that. No, but as far as like that stuff goes, this is the thing. Okay, I'm gonna give you as an example of somebody that's schizoid, that's high functioning, I guess, that's gone through the ringer, right? I've done a lot of the stuff. I did the marriage thing. I got the kids thing. I did the school thing, right? I'm trying to build a career out of this, right? I'm actually doing things, right? I die a little every day in so many regards. I might seem functional in many regards, but I don't want to be alive a lot. Okay, so and I crumble into a pile of nothing very easily. Yeah. And I don't know if you've ever seen my streams where this happens, but it happens, and I'm unabashed about it because I want to show that even somebody that's capable or competent in some regards, right, at being social, which I guess I'm competent in being social, doesn't get anything out of it. And even if they're competent, they suffer quite a bit. For example, I have to be competent right now in order to build my, I guess, project and eventually what it becomes. I have to be competent at things like networking. I have to be competent at things that communicating back and forth with people, setting up times for things, remembering stuff like that, remembering the likes and dislikes of various people in order to stay in their good graces, in order to be able to get them on here or get them to work with me in some way or something like that, right? I'm not saying that, but that's just what you do. That's normal, right? That's a normal thing that people do. That stuff is not normal to me. That stuff is not intuitive. That's not stuff that I go, oh, I feel proud of every time I accomplish, oh, I got this person to like me. That makes me feel good, right? No, I don't get rewarded for any of that. I get nothing, right? And it's really difficult because people keep describing that I should be able to get, oh, if you do these things enough, or you do this, or you do that, you're going to get all these rewards from all this interaction and from all these efforts. It's like, no, I don't get a lot of the rewards, right? The only rewards I get personally are having someone like you on and we talk about a subject, right, that is advocating an idea and a set of values that I think are important, which is helping other human beings that are neurodivergent and that I have understood their harrowing and difficult experience. That I get some reward out of, right? But the process leading up to those very few times in which that occurs, nothing. I get nothing. And it's really difficult. Like, for example, here, not that long ago, right? My partner said, like, oh, you seem so concerned about this thing, and that makes me feel as if maybe you're not, as concerned about other things, right? Oh, you're so wrapped up in your project, right? In certain regards, right? And so the way I repaired that, the way I explained to them is, and luckily I have an open partner that understands, is I told them what I am doing is in fact for my family, right? Because the way it's for my family is like this. These are my values I'm espousing here. I believe that there's a possibility that one of my children might be like me, right? I don't want them to grow up in a world that's this difficult for people like me. So I want a little bit less of that, right? It's the same as if you are autistic and you decide to have a child and you want to do something about, the world being more friendly toward autism because you don't want your children to suffer like you did, right? Okay. Number two is I don't want people to go through what I've went through, high functioning or not. I don't want people to have to go through this ostracization, this alienation, all the shit that I had to go through for the last 30 years or longer. I don't want them to have to go through it the same way, right? I'm thinking generations down the line. That's my value system, right? So I'm okay that I'm only going to maybe make a peg or two move and then I'm going to die, right? And then maybe I got the ball rolling on one or two things. That's my goal. That's good enough for me.
All right, that's good. I think that's good.
Sorry. I know,
Yeah.
but that's my point.
Yeah.
All the other shit in between.
I know. It starts again.
Stop. You told me.
No. I said when I said that's good, I meant it. Like that was good. Like that was okay. Yeah, that was all good.
So, yeah, and I'm sure there's a lot of schizoids out there that feel the same way, and that's why instead of doing what I've done, and I can't blame them, they go fuck this. I'm not doing anything,
and they hide it. They hide in their rooms,
and
right?
they just go fuck this. What is there out there for me?
Just for reference, before he answers, and I'll be quick about this. Like I'm lucky because I have the autism comorbid dual diagnosis, and autism, I get support from family and it's understanding because of the culture around autism.
Institutions support you.
I get institutional support. I get government money to help, and so then I get to be in my space and I get to be productive in my space without things that are overloading. But schizoids don't get that,
and not just schizoids. I like to say schizos because I want to take that fucking word back. But yeah, anyway.
Schizotypy is a word I like.
Yeah, schizotypies, whatever. But the schizo people, it's going to be the word I take back. I want to take that fucking word back, so that it. But my point is that we don't have any of that shit, and so it makes it that much more difficult for us to want to give a shit about navigating neurotypical society and the neurotypical world when there's no reward system set in place for us of any kind.
Yeah. And
it's black pill. Right. It's depressing, but
you're right. And, you know, I'm experimenting with what, you know, let me see what happens if I tell a parent that their child has schizoid personality disorder. I have, you know, I'm thinking out loud, not that I've done that, but the argument for doing that would be that's what they like with autism, you know, a parent may understand that there's a certain condition that they need to just sort of respect and not try to change.
Yes.
But there's no guarantee that a parent is going to receive a label like that in that way.
No, because the problem with the label like that,
I don't even think that's the way to go about it. I mean,
no, but the problem with the label like that is they're going to respond with, I didn't do anything to my child to traumatize and hurt them and give them a personality disorder. That's what they're going to hear.
I think it's important to separate the idea of trauma and schizoid personality disorder, and that the parent, you know, that it was caused by some one singular event or some, you know,
that's experience. The difficulty. It's just thought of as just a personality disorder. That's the difficulty of it. Autism is not considered a personality disorder.
Right.
And
but
so
I think I mean, there's a chance personality disorders in general can be viewed more, you know, in a sort of more medical way that's more, you know.
Well, yeah, but that's going to be hard for average people when the word disorder is in the thing, which implies that there's something wrong that needs to be changed, right?
Yeah.
Right, but with autism, it's a disorder, right?
Well, no, that's being changed. The neurodiversity movement is literally overriding that perception, and that change in movement and change in ideology is the thing which is making parents react differently to it, right? Oh, it's not a disorder, it's a form of neurodiversity that we need to respect.
Stop trying to cure autism.
Look, the problem is parents are very different. Some parents are going to hear disorder, and then that's going to bring out all this empathy that wasn't there. Some parents are going to hear you know, personality style and say, you know, man up or some bullshit like that.
That's why it shouldn't be either. It shouldn't be either of those things.
But this is why
examples of you know, the different bad ways it could go.
Yeah, exactly.
There's not one uniform way that parents are going to react, and that's why it takes you know, a sensitive clinician or a friend to work with who can understand the unique dynamics of that parent, you know, and how they're going to receive well, and try it out.
What's gross is we need institutional support, and most of us hate institutions.
Well, and there also needs to be there needs to be a paradigm shift, right? If you want the common reaction to be oh, this is a difference that we need to respect, and it can be a beautiful difference, you need to have some public awareness. It needs to be discussed, and it's just not.
Yeah. Right? No, absolutely. And I think that, you know,
that's what we're doing.
That's what we're doing. But there's also, you know, I think what you're doing is good on that level. And it's also really good on a peer process group level.
Thank you.
But, you know, in the DSM, there is a push to remove schizoid personality disorder altogether. Ugh. There's a push to remove paranoid personality disorder altogether, which is also cluster A. They want to keep avoidant, and they want to keep schizotypal.
And that's why I agree with you. We need to have both, right? We need to separate with language. What is the pathology?
Your audio, Angst. Your audio.
Oh, okay. We need to separate with language. What is the pathology, and what is the kind of cognitive style?
What is the difference? How are they related?
Like, because I think a lot of these things, like paranoid, schizoid, and a lot of the more negative symptoms, and you know, or you know, a lot of the symptoms that are bad for you, I guess, like without, you know, but they develop because of this trauma of alienation, of dismissal, of neglect, of because of that difference, right? So if it's it's a chicken or the egg kind of situation, right? So, but where we have to say, okay, this person developed pathology because of a cognitive difference. That pathology
in interaction with the environment.
Interaction. So that pathology could be termed a disorder, fine. But the cognitive difference, or is oftentimes in the DS, or it's often described as what the idiosyncratic thinking, is not pathology. And I think that's a separation.
I think what needs to happen technically is that cluster A needs to be a thing. Maybe it needs a new name, and it needs to be taken out of the personality disorder category. It needs to be put on a spectrum of its of human difference.
Schizophrenia spectrum disorders.
Yeah, I would say that would be. I honestly think the term schizophrenia is very loaded, right? And that can have some struggle, but yeah.
Fuck it. Let's take it back. That's the thing.
First of all, take it back. Here's another thing about schizoid and schizotypal personality disorders and schizophrenia is that a lot of people believe, scientists believe, and I think it makes sense, that basically those conditions are sort of almost like an immunity to developing schizophrenia, because it's sort of like this attenuated schizophrenia light. But for whatever reason, nobody with these personality disorders goes on to develop schizophrenia. They're sort of protected from it in this lower level condition. That's one, sort of etiological theory that's out there.
But here's the thing: you could make the same claim about high functioning autism. Yeah. To be frank, right? Low functioning autism is rough. Low functioning autism is as rough as full blown schizophrenia, right? It's harsh.
Yeah,
right?
absolutely.
It's harsh. And then there's people who hover right above that, but not so far in it that their entire lives are disrupted. And you can say this exact same thing, which is why I think that they need to be that cluster A needs to be taken out of the DSM in that as a personality disorder, and then put into the new neurodiversity model of autism.
I think that works. I mean, it's just a semantic difference. You could also just change the framing of personality disorders as more, significant than they currently are viewed as.
Well, I know. I mean, if we're talking about a perfect world in terms of what can be done, I think that the whole personality disorder model doesn't make a lot of sense, and it needs to be changed to a model of just brain differences triggered by different environmental stimuli, right? But that's harder than just taking
I can tell you realistically what's going to happen.
Yeah.
In the DSM right now, there's a proposal for an alternative model of personality disorders. They're not going to make schizoid a separate construct. They are talking about prodromal psychosis or attenuated psychosis syndrome or psychosis risk syndrome, which are supposed to be like a personality style that resembles schizophrenia symptoms, but actually then goes on to develop schizophrenia, which is different than these personality disorders where there's no, transition to schizophrenia. I think those disorders they're trying to add are kind of redundant and there's not much evidence for them. I'm not sure how helpful they are.
They're redundant in the sense that if you find a person who is about to go schizophrenic, it's like you're looking at a gradient of the person and going, oh, this thing that is a step along the way to what they will be is a distinct thing. It's like, well, no, it's just part of the process.
Right. But there is an argument you could include that in a broader schizophrenia spectrum.
Well, yeah. I mean, yeah, well, fair enough in terms of the progression.
But just so realistically, what they're very, narrowly focused on what personality disorders to keep, which to get rid of, and how to define them.
Yeah.
So, in my mind, the most important thing to do is to ensure the continuation of the existence of the category of schizoid personality
in some way. Yes.
to improve its definition, to improve its content definition so that it's more reflective of reality.
Schizoid personality disorder should be defined as personally, this is my thought, person on schizophrenia spectrum that underwent specific types of environmental trauma that led them to develop certain types of maladaptions that could be considered a personality disorder.
Also, another distinction
That's
is
how
like
I see it.
Schizophrenia spectrum and dissociation.
That sounds very similar
together.
to a defense mechanism conceptualization.
Because I mean that is what he just said. Yeah,
I agree. It's a defense mechanism, but we have to separate the schizophrenia spectrum part. Right, it's like okay,
it needs to be in there.
Schizoid, and that's the difficulty. Is there's a lot of there's that's the debate, right? Is there's a lot of clinicians that might argue that someone doesn't have to be neurodivergent to be schizoid, right?
Well, the problem is that there's so many different mechanisms behind withdrawal.
Is in sort of a new construct, and
or brain. Their brain structure doesn't have to differ from normal brain structure in order to be schizoid.
Right. Okay, so that's not true empirically. I mean. Really?
Yeah, but that's what I'm saying. So I think
there is debate about it. You're right. More research
yeah,
has to go on about schizophrenia, spectrum disorders.
Let's study schizoid brains if to those that want to do it. And let's find out what.
Yeah, well, there's very few labs that do that. I used to work in one, and unfortunately, the measures that were used were just not that enlightening. I mean, it was self-report measures of personality.
Oh, geez.
Jesus Christ.
And the DSM, interview for personality disorders.
Oh, no.
And there was no focus on schizoids. It was only schizotypals and avoidance. But that's the closest you can get to, an active research on schizoid.
It's funny. It's funny.
But I have the data on schizoid. I mean, it's worth, looking at. It's just not that meaningful. It's a little bit depressing to have that much data and to just not be able to have measures that, answer meaningful questions.
I think one of the reasons for that is because, like, if you look at the withdrawal that's so associated with schizoid, there's so many underlying mechanisms in their own different spectrums that can cause the same behavior, right? Like, is this person withdrawing because they're abstracting into the cave? Are they withdrawing because they're dissociating? Are they withdrawing because of reaction to other people and useless object syndrome, which we talked about last time, right? And then, so, each person
that's what got my dissertation motivated, was that question.
Each person is a unique collection of those different traits manifesting in this withdrawal, right? And so it's so difficult when you're just looking at the category when it hasn't been unpacked, because you don't really know what you're looking at. It's a black box.
Yeah. And they're not categorical distinctions between those different motivations.
Right, exactly. And the thing is, the ideal would be that when you look at the category schizoid, it's an invitation to unpack into those different mechanisms.
Yeah. So did I lose you there?
No, just the camera. Just the camera.
So yeah, I mean, I don't know what you think, but I would define schizoid personality disorder basically as a blend of DSM schizoid and DSM avoidant personality disorders, because the motivation for social withdrawal varies on a spectrum from, like Birb was saying, just like indifference to objects or bad objects, or it could be a fear of being flooded, or a fear of aggression, or a fear of rejection, or just not feeling like the energy, but those are it's those differences that determine whether someone is schizoid or avoidant, and I don't think that they're categorically distinct. So I think they should be combined into a singular syndrome that you can then understand, an individual can vary within that.
Well, yeah, I mean, but you have to add even more traits, because the traits responsible for paranoid PD combined with disassociation also produce the exact same symptom profile, right? So, like, instead of thinking that people are useless objects, if you conceptualize, or not conceptualize, if you automatically react to them in terms of receiving sense data as hostile agents with malintent towards you, and they're competent, right? But you're dissociated. You might have that thought, not have feel afraid, not have the motivation to act on it, feel like there's nothing you can do, move back into your abstract space, right?
I would be totally fine with a combo of schizoid, avoidant, paranoid, and schizotypal.
Yeah. For I mean, I don't agree in some ways, but for practicality, I think that really might be the easiest way forward in terms of actually having all of these traits available underneath the category for people to look at.
Exactly.
And then making the diagnosis is easier.
I think it's important to keep the name schizoid, actually. But
I'm down with the name. I don't want to get rid of the name.
Yeah, my whole channel is named after it, whatever. Like,
it's your channel?
No, I was being you from your perspective.
Okay.
Yeah.
Okay. Yeah. Hijacked me. Anyway.
Yeah.
Okay. Go ahead.
Let me try to sum up just one point,
do it.
A few points, I guess.
Give us your big summary that you want to give us, and then we could.
The big summary is that like one way of thinking about schizoid personality disorder is I like this term, like a disorder of introversion. I mean, you probably don't like, I just like it linguistically, but it sort of refers to a broad category of avoidant schizoid, cluster A, or even just normal like social anxiety or generalized anxiety. And that sort of framework could be a way to organize it. But in what schizoid, it's defined in the DSM as social withdrawal due to lack of motivation for social relationships because of anhedonia and disinterest in social relationships. And the implication is that there's some neural deficit, that people with schizoid personality disorder lack the capacity to have intimacy. And that I don't think is true. I think that's very detrimental. I think it's total horseshit. And anybody listening should know that you absolutely have the capacity for intimacy.
But it will be different. It will be a different
it will be different, and that it's okay.
It's okay that it's different.
And it is more. It can be more than okay. It can be a lot better than a lot of miserable people in this world. And so that's not an accurate depiction, right? That's what the DSM is depicting schizoid as, a neural deficit where you lack the capacity, whereas people with avoidant have the capacity for it supposedly, but they're just very phobic and fearful and anxious, so they go into their cave, whereas schizoids are thought to go into the cave because of this neural deficit.
I want to make a quick distinction there because it's really important. For avoidant, if you're looking at a pure avoidant expression in terms of like the most avoidant person you'll see, not very cluster A, the size of the cave is going to be almost non-existent, right? And they're going to essentially be walking around, moving away from other people, back in, out. There really isn't a space for them to go because they don't have that sort of innate difference in terms of.
That's a good point. And then you'd almost want to help them build a cave, which is somewhat controversial, I guess.
Yeah, that might be useful in some regard.
Well, I mean, look.
But my point is, I think the two are not. I think they both involve this aversion to obviously social interaction. I think
they're so fundamentally different.
Yeah, so many different reasons for why.
I think they're different enough to be kept distinct, but there should be we need to make schizoid a lot more richer and realistic. So, while keeping it separate from avoidance.
Yeah, I definitely agree with that in the sense that we need to understand that schizoid people often have comorbid avoidant traits. Not because the two traits are related, but simply because avoidant traits are a consequence of being different because other people shame you and you internalize that shame.
Yes, that internalized shame is common also in schizoid.
Yeah.
So my research has shown there are some things that differentiate them. Mostly there's similarities, but social anhedonia uniquely predicts schizoid, but not avoidant PD. The need to belong uniquely predicts avoidant PD, but not schizoid PD. And internalized shame uniquely predicts avoidant PD, but not schizoid PD. That doesn't mean it's not present in both.
Exactly.
But I'm just talking about in a regression, when you control for the impact of all the other variables, those are more uniquely predictive. But both were, schizoid and avoidant, both were associated with attachment avoidance. Avoidant was associated with attachment anxiety, whereas schizoid wasn't. Both were associated with rejection sensitivity, which was not expected. Because you would predict that only avoidant would be if the DSM is right. And there was this interesting finding about defense mechanisms that people with avoidant personality disorder used both adaptive and maladaptive defenses, whereas people with schizoid, the link was more with just maladaptive. And my belief is this is an artifact of a poor definition of these categories, because if you defined it differently, you would find that there's adaptive defense mechanism usage in schizoid PD. What else did I do in that study? Internalized shame, empathy. I just don't think the measure is that good. But schizoid PD was, correlated with lower empathy. Avoidant PD was just not correlated.
I think that's because they're failing to account for categorical empathy, which is hard to suss out, but definitely there. It expresses itself in the terms of the radical acts of self-sacrifice that come out of nowhere and surprise everybody and don't make any sense.
Yeah. But the main surprising findings were that schizoid PD was correlated significantly with internalized shame and rejection sensitivity, which is not predicted at all by the DSM categorical distinction.
What's funny is the rejection sensitivity portion is like how the way someone will react to feeling alienated by their environment might be perceived as rejection sensitivity.
Well, the way it's defined, I should tell you, it's not necessarily, I guess, obvious. It's a belief that, if you ask someone for something, they're not going to give it to you.
It's useless objects.
Yeah. That's what I'm saying.
It's that plus how nervous you are about asking.
No, and that makes sense because within the context we're describing, why would I ask somebody for something that I know they're probably not going to understand and therefore reject or often have in the past?
Mm-hmm.
What language? Also, if there's a lack of language and how to describe that feeling because your environment doesn't provide you language for it, that makes it even more difficult, right? And so, yeah, you're going to see a lack of initiative to want to express a want or need, and a belief that want or need will not be fulfilled. It's just the fundamental reasons behind why an avoidant person would feel that way and a schizoid person would feel that way are entirely different.
Yeah.
Also, how to tell your parent that your concerns feel so big and unmanageable and their concerns feel so small and you don't know how to fit yourself into their tiny box of concern.
And it's going to sound insulting. It's going to sound demeaning. They're going to think you think you're smarter than everyone or better.
You're just intellectualizing as a defense mechanism, right? Right. But that's not what's happening.
But you're just like, God damn, I'm suffering here. I need someone to fucking understand what I'm worried about.
It's too much. It's
too big. I can't do this alone. And then everyone's like, you got to relax. We got bigger things to worry about.
In that case, smaller things.
In our mind, smaller, but they'll be like, we have bigger things to worry about, like, paying these bills and getting this promotion and so on and so forth. And you getting those good grades.
Out competing the other kids in school.
Yeah, that's more important than whatever nonsense you're worried about.
Some other interesting findings were gender differences in the correlational patterns in schizoid and avoidant, which I don't have that data in front of me, but basically men with schizoid PD, versus men with avoidant PD versus women with schizoid versus women with avoidant, all had unique trait patterns that, I think are interesting. We could discuss that later.
That would be great. I can't wait to discuss
I'd be down. You know what? I'd be down to do another time just for fun because it might get some more conversation, fun stuff going. Is there any way you can have any of this stuff handy, and then we can just kind of discuss even if it's not good data as you describe or you don't like it or whatever?
No, of course I could do it. If you want me to, I could do a whole. I did a presentation at the New York Psychoanalytic Institute. And before the presentation started, there was a blood-curdling yell, and someone actually died in the downstairs from some heart attack. But that's neither here nor there. I ended up.
Why is that funny?
It's not. It was so crazy. It was really awful.
No, why is that funny to me? I'm trying to figure that out.
Because I'm sitting there. There's people in the audience. Nobody knows what to do. They're looking at me like I should go on with the speech. Okay. And I have to make a call of what I'm going to do. I'm looking around, I see some people like talk, but like, I couldn't do it. Eventually I'm just like,
I think what gets me is the comedy of how absurd a situation like that is.
It was absurd. People's reactions to it were totally absurd. And
you could have written an article about just that, the moment alone.
But eventually I did do a PowerPoint so I have that, and I'm happy to make a more organized presentation. No, I didn't.
Oh, that's dark. Oh man.
He was very schizoid too, to be even darker.
No way.
Yeah.
Well, why weren't they there at your presentation though?
I don't know. Maybe it was triggering.
Maybe you. No.
Believe me, I processed it all.
No, I'm kidding. I was gonna. My humor gets too grim. Like my gallows humor. No, because I was gonna say maybe you're the one that gave him. I'll leave
on a controversial note here for both of you. Humor is one of those adaptive defense mechanisms, like intellectualization. If someone told me I was intellectualizing or using humor as a defense mechanism, I say, thank you. I'm glad you think I'm high functioning.
Better than punching someone, right? Better than punching someone or just taking a bunch of opiates or something.
Yeah.
I guess.
But of course, somebody could use it in an insulting way. I guess I'm trying to be sensitive to listeners who feel like intellectualization as a defense is, an attack and an inaccurate description of what they're going through.
There's a time and a place when intellectualization is a good adaptation.
Absolutely.
I think that's all we have to say.
I just don't even. Okay. I don't even like the word because it's so non-specific. Because the intellect is a lot of what you're. I mean, it's so broad. It's many things fit into it. Like,
absolutely.
It's a mess. All right.
It doesn't say anything positive about the kind of thought going on.
All right, Birb. I think we fucking pushed this thing too far enough.
No, my wife has come out 3 times.
Okay, we don't want to get anyone in trouble. All right. Yeah. Well, thank you. Any last quick things you want to say? Website, all that kind of stuff for people.
Yeah. I'm still perfecting this personality test for Schizoid PD that I put a lot of, blood, sweat, and tears into in terms of picking out the items. So any feedback on what item seems irrelevant to measuring Schizoid PD would be helpful, or a compliment like, wow, that item is really clever, that would be cool to hear too. I would wait a little bit to go to the website, or you could go now. It's like $7 to take the test, but there's some like web functioning issue. Where
so maybe wait a few days.
Wait a day or two. Yeah. Otherwise, you're gonna. Unless you want to text me, and then we'll have to go back and forth, and I'll send you the link personally.
Or unless you're watching this a week from now, which hopefully by then.
But I think a lot of you have probably already taken it when it was, when there was no paywall. So any feedback would be great. I'm also thinking, actually a process group would be a really good idea over Zoom.
I think so. Yeah.
Well, I mean, if you'd be interested in that, well, we can communicate, and I can put out a APB for schizoids interested in something like that.
It's nice to keep the groups kind of small.
I know, but if you wanted me to like find people,
I think it would be a good idea.
You could tell me, I have this many slots for people that are interested. And then maybe you tell me what we do from there. Okay.
That sounds good. And I guess people, I kept encouraging therapy and finding a good therapist. So if, people have questions about that, maybe write them down. I just wish there's some way I could sort of break that barrier so that it's easier to figure that world out.
It's a tough one.
But that's it. Yeah.
Okay. What's the website again?
It's psychologistsny.com.
Psychologistny.com. So psychologistnewyork.com.
Yeah. But just NY.
NY. Yeah, got it. Perfect.
Yeah.
Okay.
All right. Thank you.
Not a problem. Thank you for being with us.
Peace out.
Awesome. Peace out.